there was some confusion on. Let me just see if I've got you. Yep, Brittany. Okay, so I'm going to trade you. I'll take that. You take this, and then you can have a seat. There should only be one left. All right, well, we probably have one more coming, which means I may have to like put somebody at the end. We'll see. We'll see if they come. So yeah, it is a really big class. Okay. So give me just a second here. OBS. Start virtual camera. Sorry, guys. Give me a second. I'm having technical difficulties. All right. Would you look at that? I might have actually accomplished this. We shall see. Okay, Brittany, can you give me your last name, please? Foran. AND. Okay. Okay. Looks like everybody's here. We are missing one. I don't know whether she will be here, but I got to get another set of books on break. All right, guys. I know I'm a little bit all over the place today. I'm sorry. I'm amazed it worked. Okay. Get where everybody can see me. Is that better? Good. All right. I know you kind of have to look sideways. There's a lot of you. And I also have the new camera equipment. So I had to kind of rearrange the room a little bit to make it so that everybody could come in. My name is Patricia Laramie. I'm an RN, and this is what I do. I teach CNA, not only in the classroom, but also online. I run the #1 CNA resource on YouTube. We have over 25 million views. We're really, really big in YouTube world. I also am an author of CNA training materials that is being used all over the country. And I tell you that because, not because I'm trying to pat myself on the back, but because I am the subject matter expert on Prometric testing in the nation. So that's going to help you because I know the test. Okay. So that's what makes me qualified to sit here. And I know we're in a very small room in Spring Hill, Florida. You know, it doesn't really kind of compute, but I am actually contacted by schools, universities. HCA Hospital actually had me develop their CNA program for them nationwide. So we're way bigger than we look in this room. Okay. But I do still teach locally because I enjoy teaching. This is what I like to do, is stand in front of brand new shiny faces that are scared out of their minds and get you to confident, self-assured, and competent CNAs in 4 weeks. So we've got our work cut out for us. There will be some work for you to do. You will have homework. You will need to practice. but I'm going to take care of all the heavy lifting. Okay. All you have to do is follow along. So stay reasonably awake and we'll be good. Sound good? Okay. So I'd like to go around the room briefly because there's a lot of you. I'd like to go around the room and learn your first name and then a little bit about what brought you here. Are you here because you're already working in healthcare and you need that certification to continue or to move up? Are you here because you've always wanted to be in healthcare? You've got that caring heart, that caring spirit, and this is step one. Are you here because you're getting ready to start a nursing program or a PT program? Or are you here because mom kicked you off her couch and said, go do something? You're driving me nuts. You know, if I know a little bit more about what brings you to class, I can help tailor it a little more specifically for you. So if I can start with you, just your first name and what brings you here.
My name is Paulette, and I was doing housekeeping for like 7 years.
Okay.
And I just wanted to move up in the company, so I decided to do PCA.
Very good. Very good. So you actually are in a very unique position because you've gotten to see healthcare from the outside in. And I'm sure you've seen what not to do and what to do. So you've got some very good exposure there. So welcome. Hi.
I was a med tech for a year.
Okay.
And I thought CNA would be a great way to go, especially since I'm going to school for EMT. So
Oh yeah, very good.
just taking that route right now.
Okay. Awesome. Awesome. CNA and EMT is very different.
I just like healthcare.
But yeah, but there's a lot of crossover too. A lot of the concepts are going to cross over. The difference between CNA and EMT, and this gets, you know, in medicine, I call it alphabet soup, right? So I go live every Thursday at 3 on my YouTube channel. And this is one that I just did the other day was alphabet soup because there's so many initials out there. And, you know, it's very confusing as to what does what. But the difference between, for those of you who want to know, CNA and EMT is EMT is responsible for short-term stabilizing care until we get you to somebody that can do something with you, right? We're just trying to stabilize you to get you to somebody else. CNA, we get them after all that, right? So we are responsible for custodial care. So helping patients with routine tasks. Our patients are stable and we're going to follow a care plan. So the big difference between CNA and EMT is that EMTs have to think to figure out how to stabilize somebody with the situation that they're dealing with. CNAs never think. And we're going to talk about that on, you know, as we go through. So welcome. Welcome. Hi. Okay. Hi, Ty. So are you working as a TNA right now? PCA? Okay. And you're looking to get certified then. So welcome. Very good. You got some good experience behind you. My biggest challenge is going to be to get you guys to unlearn a few things. So welcome. Hi. Wow. Okay. Yeah. Early mornings with dialysis. That is not my field. I am late to everything. Yes, it does. It does. But you get off early too. So, you know, balance. Not always. Yeah. I know. Used to be way back in the day. My best friend was a dialysis nurse and she would go to work at, you know, 2:30, 3 o'clock, but she'd be off by like 11, right? But then they started cutting back on techs and putting patients in later in the day. So she got to where she was working 14, 16-hour days. And yeah, it got to be a bit much. So welcome. Hi.
Hi, Tracy. I work at Oakville, and I don't know what brought me here.
You know, the free drinks, the food. Well, welcome. We're going to help you sort it out. Welcome. Hi.
I worked in a sales business and corporate and got burned. So I'm thinking about going back I'm originally a teacher, finished all the schools in Croatia, and I couldn't transfer my diploma over here, so I looked online into what else would be suitable and decided to go in the health business.
Healthcare is the most, has the most opportunities, and it is the most recession-proof business. I don't know if you guys have been paying attention to the news, right? So recession-proof is a very big deal right now. You want to be in a position where you're not going to lose your job tomorrow. And healthcare is the one recession-proof business, because no matter what the economy is doing out there, people still get sick and they still age and they still have health issues, you know? So healthcare, it's pretty stable. So welcome. Hi.
I've been a PCA before,
Okay.
in home health care and home health aid also. I just want to go work in the hospital.
Okay. All right. So you're trying to get the tools you need to get into a different setting. Very good. Very good.
Steady work.
Yes, steady. Yeah. Yeah. Well, welcome. Hi.
I've always wanted to get into the hospital.
Okay. So good heart for it. Welcome. Yeah, we'll tell you everything you need to know. Probably a few things you don't. So welcome. Hi.
I was before in the healthcare, like home for old people.
Okay.
I was originally from Puerto Rico and then I moved to Pennsylvania. And then I worked like a warehouse, but it's like the work I'm supposed to be doing all there. So I just gonna move here like a year ago, and then I started like working in nonstop. It's a job that I like, but not like a hair care. So
Right.
it's starting a new opportunity here.
Very good. Very good. Awesome. Well, welcome. Welcome. Hi.
Some of my family, so
Okay. Might as well get paid for it, right? Yeah. Don't give it away for free. Get paid for it. Welcome. Hi.
I guess I always wanted.
Okay. First step. Oh, I like blank canvases.
I
Yeah.
recently got
Oh, very good. Starting the whole brand new world. Welcome. Hi. Okay. Okay. Yeah, it's got to be unexpired and it's got to be in a reciprocating state. So we'll get you through the test. You've got some good experience behind you. Things are a little bit different though. So your biggest challenge might be to change some, some habits that you have. So welcome. Hi. Okay, step one. All right. So it sounds like everybody's in the right place for the right reasons. I didn't hear that you're looking for fame or fortune, which is good because this is not the place for you if you are looking for fame and fortune. Just put this here. So you're going to be getting a couple of emails from me later today or tomorrow. I'll have to see about my timing. And those there's going to be two of them. So one of them is going to kind of give you information on how to access the Zoom live broadcast. And the other one is going to be an invitation into the online program. Now, we have a CNA online test prep program that you guys all get access to for free as being part of this. That's probably not going to be important to you while you're here because you have me live in front of you. You don't want to watch me in a talking head on a computer screen, right? You got me live. But in addition to talking head videos, you also have interactive activities in there. And that might be interesting to you and helpful to you to be able to learn the principles that we're going to learn, but to put them into practice before you actually get up and start to practice. So the online program, although you may kind of think, well, I really don't need that, I've got the classroom, I would probably take a little tour through it just to see what's in there because it may be helpful to you while you're here. but it's really going to be helpful to you in the couple of weeks between graduation and testing. That's when you're probably going to use it the most. Okay. Sound good? But you'll get 2 emails from me, one with an invitation. Now, when you get that invitation, okay, you got to click the link. It'll take you to the website, and then you're going to create an account. When you create your account, make sure you use the same email, because the email is the glue. So I put your email in, it sends you an invitation. You create the account when you get there. If the email doesn't match, it doesn't glue you in. Okay. So if you've got more than one email, make sure you're using the one you gave me. All right. Good. Questions? No? Everybody good? All right. So we're going to start out with a video this morning. And that video is going to kind of lay a foundation. It's going to kind of walk you through what we're going to be doing from here on. It's going to go over the nursing process. You feel free to sleep through anything else. This video is not something you should sleep through. Okay, this is really, I'm going to be referring back to this over the next 4 weeks. This is our foundation. So this is like really important. It's about 15 minutes. It's animated, so stuff to look at on the screen, not just me talking. But it's helpful to have visuals along with verbal for this. Okay, I find that you get it a little bit more. Now, the good news is if you do fall asleep, you have access to this on my website, foryourcna.com. We'll go over this. It'll be in your email, foryourcna.com. It's also on the front of your spiral book, the little computer at the top on the cover of the spiral book, foryourcna.com. If you go to CNA training, that's you, right? You're in training. So I've got training, testing, all these tabs at the top. If you go to training under animated lessons, you'll be able to see this video. Okay, sound good? All right. That spiral book is yours. You can write in it. You don't have to worry about taking notes on this. I've already taken the notes for you. They start on page 8, 9, 10. Actually, if you go to page 10, do you see that little video clapboard at the top? It says the care plan and the CNA. Anytime you see that little video clapboard, that means I have a movie that goes with that lesson. So you can read it if you want to, or you can watch the movie, or you can do both and get everything. So it kind of depends. It's a choose your own adventure program. Some of you learn very well by reading. Some of you not so much. You'd rather watch something. You need to be entertained. Some of you are going to need a lot of repetition, and that's why we have it in a couple of different ways. Plus, I'm going to say the same thing over and over as we go through the program. Okay, so good? Questions? All right. And then after this video, we're going to do a little activity. And then I'm going to explain the books in front of you and the syllabus. We're going to go through how this whole program works. But in order for me to get there, I really need to do this first because I'm going to refer back to this. Sound good? All right. So, like I said, we are kind of in the middle of a changeover here, a technical changeover. So this week, you're going to have the projector and the screen. Next week, you'll have the TV. So I've got, I've been using this for about 5 years now, but it's big, but you know, the colors are kind of washed out and that type of thing. So I'm switching back to a TV, but it's a big one that's going to go on this wall. Now, the reason for that is that next week, hopefully, we're going to have cameras above the bed pointing down. So that's what that is for. So as I'm teaching, if I've got somebody over here and I want to show you something, I can get you know, a patient in the bed, I can switch cameras and you'll see top down and that's going to be on the TV. So pretty cool, right? Pretty slick. Yeah. I don't know how to use any of that yet. So you guys are going to be the guinea pigs. We will see. Okay. So I'm going to ask you if you would okay. Can you pass that back? And I'll come over and plug it in. You don't mind? Thank you. Have to put you to work. Okay. This is going to be a little loud for you, the speaker right there. And it's Ty, is that correct? Oh, I got 1 out of 13. Little ways to go. Can you hit all 4 of those light switches for me? Just turn them off, please. Thank you. This used to be up there, but then I had to run the cord. Okay. There we go. Okay, it's got to be super close, apparently. Come on. Okay, there we go.
The care plan and the CNA, why it's always about the care plan. A presentation brought to you by foryourcna.com. Thank you for joining For Your CNA's online CNA test prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for? Certified Nursing Assistant? That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all testing skills. But that is only the beginning of graduation. You will learn way more on the job because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the activities of daily living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do. How will I know what I'm supposed to do with each patient? I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it in perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs, bedpan or catheter. I also know she is at risk for constipation, since she's not moving much and she's on pain medication. This is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly? I can, yes. Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness out of the room, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that the patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged. I'm not sure I understand. Are you saying the care plan is going to change all the time? Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving. Doesn't this mean that I'm going to bother the nurse all the time? Won't they be annoyed? The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities like nursing homes and ALFs and even home care. But in other settings like hospitals, rehabilitation centers, and hospice, patient health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer. And the nurse is legally liable for that. Remember, you are an assistant. You are there to help. But the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When a patient is stable, you will not have much to report. It may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks. CNAs follow the care plan and record changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs? For the care plan. As a CNA, you follow the care plan, the whole care plan, and nothing but the care plan. Anything unusual that you notice about the patient, you must report it to the nurse. Great job. For the exam, you will receive a care plan. What should you do? Follow it exactly. That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
Can you grab the lights for me, please? And can you unplug, please? That way I can move this out of your way. Thank you. Yeah, it looks like it's a good time to retire the projector. It doesn't seem to want to work anymore. I think it knows. So, how do we know what to do with each patient? That is the easy answer. 75% of the written test is going to be on that topic. They're going to try to trick you. They're going to try to get you to think. So there is a sentence I want you to memorize. This is not written down anywhere. It's probably one that you want to write down. So inside the front cover of your white book, you open up your spiral book inside the front cover. I want you to write this down. CNAs perform routine tasks. I should have asked, does anybody need a pen? Okay. CNAs perform routine tasks on stable patients according to the care plan. That is your entire scope of practice right there. According to the care plan. So CNAs perform routine tasks on stable patients according to the care plan. That's what you do. Now we got to learn how to do those things, but I'm willing to bet most of you know how to brush teeth, right? So these are not difficult tasks to learn. This is, for the most part, basic body maintenance, things you do for yourself every day. But you're going to do them on stable patients, routine tasks on stable patients. What if the task isn't routine? Who would need to do that? The nurse. What if the patient isn't stable? Who would need to do that? The nurse. We perform routine tasks on stable patients. And how do we know what to do? The care plan. That's it. If you understand this one sentence, 75% of that written test, easy. Easy. Are you allowed to think? No. If you catch yourself saying, I think, stop. You don't have enough information. Now, a lot of people say, oh, that sounds demeaning. You know, I mean, that kind of sounds like CNAs aren't important. No, you guys are like the most important part of the healthcare team. You really are. Because as a nurse, I don't get to spend much time with patients. I'm charting, I'm passing meds, I'm doing treatments, I'm scheduling tests, I'm looking over lab values. I mean, most of my time is sitting at the nurse's station doing nursing stuff. I'm not in the patient's room. I have you to do routine tasks for me. So I don't have to be in the patient's room, right? So who's the one with the patient? Yeah, the CNAs. So you will know those patients way better than I will. I'm at the desk. So if you see a patient that has been perfectly with it and today they're a little confused, you need to let me know that, because the very first thing I'm going to think is that they have a UTI. Well, that doesn't make sense, right? Confusion, UTI. But in the elderly, confusion is the very first sign of a UTI. They don't get all the other symptoms that we get. Okay. If you've got a patient who has been walking just fine, absolutely fine, but today they're kind of shuffling their feet. They're not, it's like they can't pick their feet up. Well, I may think to myself, that patient may be developing Parkinson's. I need a neuroconsult. Okay. They also might have just done a few too many squats yesterday and, their legs hurt. I don't know. I have to go in and figure it out, right? But you can't make that decision. You can't think in your own mind, oh, that's not important. I don't need to report that, because it may be. Does that make sense? So it's not that I'm minimizing your role. Nobody's minimizing your role. You have the most important role, because if you don't notice that the patient is shuffling and telling me about it, is that patient going to get the care they need? No. So I rely on you to be my eyes and my ears when you're in there doing those routine tasks with the patient. Without you, the whole wheel stops rolling. That's how important your role is. But that also means you've got to have excellent observation skills. So let me pull out my soapbox for a second here. This is one of the problems with our current healthcare system. Anybody ever hear of travel CNAs? Anybody hear of that, right? Yeah, and most of you are like, oh yeah, sign me up, man. I want that money. I just want to get some experience. I'm going on the road. I'm getting that money, right? So here's the problem with that system. If as a nurse, I have to rely on you to tell me when there's a problem with the patient, if I don't have CNAs that are used to working with that patient, are they going to pick up problems? No. And that's why things are getting missed. Because as CNAs, we need a stable CNA workforce for this whole system to work. If we have a bunch of travelers coming in and out, or agency CNAs coming in and out, people that, I mean, let's face it, most older people, they kind of look like other older people, right? But they're not. They're individuals. Henry is completely different from Harvey. They're different. But if you are an agency CNA and you just come in for this one shift and you don't know Henry and Harvey, and they both are old men and they both sit in a wheelchair and they both wear brown sweaters, you're probably not going to notice anything that's different about them because you're not familiar with them. Now, if you've been working with Henry and Harvey for 6 months, you'll pick things up. So this is the problem with agency, because we don't have a stable CNA workforce. Don't have a stable nursing workforce either, which leads to all kinds of bigger issue problems. So we kind of have to think about this as we're planning our careers. Yeah, the money's good. Absolutely. And I'm not going to tell you not to do it, because I got bills to pay too. But I am going to tell you to think about that when you're an agency CNA, and understand that you may be missing things. So it's vital that you understand the observation and reporting part of CNA. That is half of your job. Make sense? Okay, give you a little bit different perspective on that. Good? Okay, let's see if you learned anything. In your white book, turn to page 12. You'll see an activity there. Again, you can write in this book. I want you to take about 3 or 4 minutes to do that activity for me, please. Give me 1 second, guys. We'll go over that in just a second. That doesn't work. Okay. All right. So on page 12, we're going to see if you got what that video was trying to tell you. So, boy, that computer is really struggling. Okay. So number one, you receive the displayed care plan. How far will you walk the patient? What do you guys think? 10 steps. How come it's not until the patient gets tired? That's not what the care plan says. That's the easy answer. So a lot of the questions I'm going to ask you in this class, the easy answer is it's not what the care plan says. Okay, I'm training you for the test. It's not what the care plan says. If the care plan says 10 steps, we're going to walk them 10 steps. Yeah. And by the way, walking is, you have to take return trip into account. So 5 and 5. Yeah. Number two, what is required to assist that patient? Yeah. Why can't we use a walker? You know, we might think they're a little unstable. Maybe they might fall down the hallway. Why can't I just decide to use a walker? Not in the care plan. Easy answer. Not in the care plan. Absolutely. Now, if I have a concern, okay, if I look at this patient, go, 10 steps, not so sure about this. I think this guy might fall on me. What should I do with that information? Tell the nurse. Leave them where they're at. They're safe wherever they are, right? Because we haven't started walking yet. Go let the nurse know, hey, I don't think this guy's going to make it 10 steps. And let the nurse figure it out. Not our job. Not our job. Yeah, we don't think. We do not think. Guys, how hard can the test be? Right?
What are you thinking with the transfer belt or walker? Then what do you choose, or you will ask the patient what's the preference? If the care plan doesn't state anything,
Then nothing is required. We don't decide to use anything. So let me give you an example of this. Actually, I'm going to hold off on that 1 second. Okay. But I'm going to address that in just 1 second. So we're going to follow the care plan, the whole care plan, and nothing but the care plan. So that would fall under that nothing but the care plan. So if the care plan doesn't say gait belt, do we use one? If the care plan doesn't say walker, do we use one? Okay, so we follow the care plan, the whole care plan, and nothing but the care plan. Good? Okay, so let's go on to 3. What body part are we exercising here? Hey, the right hip, knee, and ankle. Why can't I do the other one? I mean, guys, we all know exercise is good. This patient's stuck in bed, right? All kinds of complications can occur. Why can't I go ahead and exercise the other side? Not in the care plan. Do not think. So let me explain to you why that's not in the care plan. This patient is confined to bed because they have a blood clot in that left hip or left, I'm sorry. So that's why they're stuck in bed. We don't want them up moving around because activity can increase blood flow, which can dislodge the blood clot, and poof, we've killed our patient. So that's why he's stuck in bed. But because he's got a blood clot, he's at risk for more blood clots, especially if he's laying in bed. So I'm going to ask you to go in and exercise the leg that doesn't have a blood clot, which in this case is the right one. So if you decide when you're in there, oh, exercise is good, everybody needs exercise, this poor guy's stuck in bed, I'll go ahead and do the other leg too while I'm here, you can accidentally kill your patient. So here's the problem. CNAs kill just as many people as surgeons every year. About it. I think we should be talking about it. Right? That's a big deal. Because if you're not following that care plan exactly, you're putting your patient at risk because you don't have the whole story. Anybody familiar with like dramas, you know, like Party Down South or 90 Day Fiance or soap operas, right? Right. So turn on any drama, watch it for 2 minutes, turn it off and tell me everything that came before and everything that comes after. You can't. You can't. They're unpredictable, right? Unpredictable. So that's the problem here with CNAs, is that you're getting 2 minutes of the story. You don't know what came before, and you certainly aren't going to know what comes after. You're seeing 2 minutes of the story and trying to make decisions based on that little tiny sliver of the story. You don't have all the information. Does that make sense? Okay. The nurse has more information. They've watched a season of the story. They still don't have the whole story. Who do you think knows that patient inside out, upside down, and knows the whole story? No, the nurse has only seen a season. Who said it? The patient. The patient. So don't you think they should be a partner in this? They've got the script. Okay, they met the director. So don't forget that the other party in this whole scenario is the patient. They know themselves way better than we do. So don't be afraid to talk to the patient. Right? Is that normal for you? I have asked that question a million times in my career. Hey, you're walking a little funny. Is that normal for you? Oh, a lot of times they'll say, oh yeah, I've been walking like that for years. I got a bad knee. Oh, okay. Or they may say, no, this just started a couple of minutes ago and man, it really hurts. Well, if I hadn't asked the question, they're probably not going to volunteer it because they're here for a gallbladder issue, not a leg issue, right? So they may not even acknowledge it. So remember, your patient is the one with the script. You've watched 2 minutes of the show. Don't start making any decisions. Good? Good. Okay, that'll keep you out of trouble. All right, so let's go down real quick to number 7. You receive the displayed care plan. What vital signs are you required to obtain? The pulse. Why can't I do the rest of it? Yeah, it's easy answer, guys. Easy answer. All right, but the last question is the one I really want to get to. How long do you need to count this pulse for? All right, this is where a lot of people go off track. So how many guys that are currently working in healthcare have taken a pulse? My med techs, I'm sure. Yep. All right. How long do you count for? What's that? 30 seconds, maybe 15 seconds. Multiply that by 4 to get your full minute reading. Or some of you don't take the pulse at all and you use one of these little guys, right? Right? So because you've got a little bit of experience here, this can derail you. Now, what's really hard about this is that chances are you guys, before you go to test, you're going to go on YouTube to watch authorities demonstrate these skills to make sure that you're doing it right. We all use YouTube to learn. Like, I learned how to grout my bathroom with YouTube, okay? I learned how to put a electric start motor on a cement mixer via YouTube, okay? So we can learn anything on YouTube. The problem is that just because it's on YouTube doesn't mean that they know what they're talking about, right? That there's no test you have to pass to be on YouTube. So the problem is that some of you will go on YouTube and you'll type in CNA pulse and videos are going to show up. And most of the videos out there are going to tell you to take the pulse for 15 seconds and multiply it by 4 because that's what we do out there. But what does this care plan tell us? 1 full minute. So this patient, this one right here, this guy, that 15 seconds isn't going to work for. We need a full minute. Maybe the patient had a medication and we're trying to gauge the effectiveness, or maybe we need to give digoxin, which is a heart medication, but that lowers the heart rate. So we got to make sure that they're at least over 60 before we lower it. Right? So maybe I need a full minute count to figure that out. Or maybe the patient just walked somewhere and came back and we want to see the effect of exercise on the heart. So there's a million reasons why the nurse would want a full minute count, that shortcut thing isn't going to cut it for this patient. Do we need to know why? Do you think we need to know why? No, we follow the care plan, the whole care plan, and nothing but the care plan. We don't have the full story. We got 2 minutes. 2 minutes of watching this story. All we got to do is follow the directions. Good? Does that make sense? All right, so let's talk about the test real quick. So when you go take the CNA test in Florida, there's 2 parts to it. There's a written test that would have questions similar to this, not exact, but similar. Okay. And you're going to have a clinical test where you actually have to go in and do 3 skills in front of 2 RNs. And they're going to grade you. You have to pass both parts to be a CNA. Sound good? I'm going to get you there. Easy peasy. But when you go take the clinical test, they're going to give you a care plan set that has 3 skills on it. Now, what do we know to do with a care plan? Exactly. Okay. So we don't change it. We don't alter it. Whatever those words tell us to do, we're going to do. If those words tell us to stand on 1 foot, we're standing on 1 foot, right? We're going to follow that care plan exactly. Good. Do you think it would be helpful for you guys to have the care plans for the test before you go test? It'd be nice, wouldn't it? You see these care plans? These are the testing care plans. So if you ambulate the resident with a gait belt, that first one is the care plan you will get. That is exactly what it says. That is the testing care plan. If you get range of motion to the hip, knee, and ankle, that is the care plan. Good? But that's only 4 skills. You have to learn 20 plus hand washing, which is 21. Wouldn't you like the rest of them? Wouldn't that be helpful? I gave you 4. Probably want the rest. Go ahead and turn to page 19 or 17 for me. Yes, 17, not 19, sorry. Okay, so 17, you see a bunch of clipboards. I told you for the test, you're going to get 3 skills to demonstrate. Well, the test actually develops sets of skills, and there's 11 potential sets. You will get one of these 11. So these are the testing care plan sets. Now, there's a formula they use to develop these. So on each testing care plan set, each one of these 11, you're going to have 1 ADL skill. We'll talk about that in a minute. You're going to have 1 mobility skill. We'll talk about that in a minute. And you're going to have 1 documentation skill. Everybody gets a documentation skill. So this is how the test has portioned these skills out. They also look at timing because it's not fair for you to get 3 super long skills and you to get 3 super short skills. That's not fair. So they have to look at timing as well, how long these skills take. Because there's some skills that take a long time, like partial bed bath. Somebody with your level of experience, they give you 19 minutes to do it. 19 minutes. That is an incredibly long period of time. Well, they don't want to give you 2 more long skills to go with it, right? So they have to look at timing. So these are the exact testing care plan sets that you would get when you're testing. You will get one of these 3. Now, this really doesn't help you. It really doesn't. Students get all hung up on this. That's why the page is in there, because everybody kept asking me. And I kept telling them, you don't need it. But they kept asking, so I put it in the book. The reason this doesn't mean anything is because the test is 1 day out of your life, 1 day out of your career. And in reality, it's 40 minutes out of your entire career, 40 minutes. Because that's the longest care plan set is 40 minutes. So if you're focusing all of your time and energy on preparing for this 40-minute window, you've kind of missed the point. Because after you get certified, you're really going to have to do this on real live breathing humans. Don't learn it for the test. Don't learn this stuff for a 40-minute window. Don't get all wrapped up over which skills go on which care plan. Who cares? Because out there, it's not going to matter a bit. You got to learn this because I might be the body in the bed one day. In fact, I'm going to be the body in the bed one day. I'm hoping you get this because I got to get some good caregivers before I become the body in the bed. I've seen what's out there. Okay, we got to do better. Make sense? Don't focus on the test. I'm going to get you through the test, and we will talk about the test as we go. But I do not want that test to be your main focus. It's 40 minutes of your life. That's it. We got to get through that to get to the rest of our life. Yes, it is important. And I'm going to tell you everything you need to know to pass it. But I don't want you to focus on it. I want you to remember that after the test, that's when life starts. Okay, good. So I told you I go live every Thursday at 3. Well, one of the questions I get almost every week, because it's a question and answer session. I answer questions from people all over the world. We have people from Kenya and from France and all over the place that join us. But one of the questions I get asked a lot from people in Florida, because of COVID, which skills aren't they doing? Who cares? Who cares? You need to know to do mouth care, not for the test, but because the day after the test, that patient in the bed needs mouth care. You know, don't not practice it because it's not going to be on the test. That's kind of missing the point, right? Good, makes sense? Okay. So CNAs do routine tasks on stable patients according to the, okay, that care plan is going to help you adapt that skill to this patient. So I'm going to show you how to do the skills. But every patient is not the same. We're going to have to modify this. So the care plans that you see here, oh yeah, they're good care plans for this patient, not for any other. So as an RN, when I get a patient that comes into the facility, my job is to do a head-to-toe assessment. And I got to learn everything I can about this patient. I mean, everything I can. I'm looking at their past medical history, their past surgical history, what brought them in here. I look at all of their body systems, all of them. I look at their habits, because if they're a runner, that's going to affect their cardiovascular system. Lower pulse rate's going to be normal. If they're a weightlifter, that's going to affect their cardiovascular system. They'll have a higher resting heart rate in most cases because weightlifters generally don't work on their heart muscle. They work on the visible muscles. So we give them more to feed, more for the heart to feed, but we don't strengthen the heart. Okay, because cardio leans you out. You don't want to be leaned out when you're, bulking up, right? So I have to know that. If you're a couch potato, that's going to affect your cardiovascular system. It's also going to affect your digestion system. It's also going to affect your lymphatic system. It's also going to affect your bones. Believe it or not, couch potatoes tend to have brittle bones. So I have to look at everything with that patient. And this is why I had to go to school for years and years and years to learn what all of those things I need to be looking at are and what it all means. So I can write out a care plan that tells you what to do with that patient, right? So if I am the RN and I go in and I do all the head to toe assessment, I'm looking for real problems and potential problems. So let's talk about this lady over here. Let's say that she had a right hip replacement 3 days ago. And she developed an infection in the incision. So we've got her on antibiotics right now. Well, I know, so we got some real problems going on, right? So she is stuck in bed. She's got an infection. She can't get up to the bathroom. She can't brush her own teeth. She's super weak. I mean, she's sick. She is really, really sick. So, man, we got a ton of stuff to do with her. But it's not just real problems. I got to look at potential problems too, because those antibiotics are going to strip out her system, which is probably going to give her diarrhea, which is no fun in bed. So I probably need to look at maybe some sort of probiotics or encouraging yogurt or something like that to help replenish the good bacteria in her system so we don't end up with those really bad side effects. I got to look at that. I also know, because she's stuck in bed, that she's at risk for pneumonia. So I got to work on a strategy to help prevent that from happening. I also know that she's at risk for blood clots. Oh, we better work on a prevention strategy for that too. So I got to look at not just real problems, but I have to look at anything that could happen and figure out how we can avoid that. Now, that takes a lot of work, a lot of thought process. So I'm going to go in, do my assessment. I'm going to go out and I'm going to write all of this up. Now, in the meantime, you're coming and telling me things. You're coming and telling me things about other patients. The phone's ringing off the hook. Family members are coming to the desk. Do you think there might be a chance that I might miss something in there? Yeah. So if you are working with patients and you think to yourself, oh my gosh, this nurse is horrible, she missed something, go let her know. Hey, there's nothing about mouth care on this care plan. The patient can't brush her own teeth. Should I be addressing this? Right? Because nurses can get distracted. But this is why I need helpers. I need somebody, because that takes a lot of work, a lot of time, ton of time. Now, if in the next bed, this bed over here, I got a patient I've already done all that on. This patient can't get out of bed either and needs to be turned every two hours, repositioned and changed every 2 hours. Their sheets need to be changed once a shift because they've got COVID and they're sweating like crazy because of the fever. And, you know, they have to have mouth care, bed baths. I mean, there's a lot of care that this guy needs. Am I going to be able to write up all that if I'm over here doing this? So I need a helper. I need somebody that can do a routine task the way I ask them to do it on a stable patient. So what do I need? I need a CNA. That's right. And I need that CNA to understand that if they see anything funky with this patient while they're doing all that stuff, that they're going to come let me know. Good? Okay, you now know how to pass the state exam. That's it. You're going to get a care plan with you're going to get a care plan set for the test with 3 care plans. What are you going to do? Follow it exactly the way it tells you to do. The written test, we do routine tasks on stable patients according to the care plan. You have everything you need to pass that CNA state exam now. I'm going to show you how to do all these skills. We're going to talk about it. But you right now, in the first hour and 15 minutes of the class, have all the knowledge you need to pass the test. That doesn't mean you should stop coming. Okay. I have more. I have lots more I'm going to give you. But I need you to understand that it is not difficult. This is literally an open book test. You get a care plan. And not only do you get a care plan, you don't even have to memorize it. So for the test, they're going to give you a care plan. These are the care plan sets from the test. They're going to give you the care plan set. They're going to read it to you. They can't even trust you know how to read. They're going to read it to you. And then when they're done reading it to you, they're going to hand it to you. Go ahead. And that is now yours for the entire test. So if you're in the middle of the skill and you can't remember, am I turning them on the right side, left side? I can't remember. I'm testing. My brain is gone. I am like closed down. Go over and read it. That is your care plan throughout the entire exam. They don't even expect you to memorize it because we know you're being tested. Right? You're going to be lucky if you can remember your name. Now, I say that, but let me tell you something. And this really is funny. So I told you that I'm the #1 CNA resource on YouTube, right? 25 million views. That's a lot of students. A lot of people out there watching our videos, getting ready to test. And a lot of those students are nervous. So I know some of the evaluators, and the evaluators have told me on many occasions that it's hilarious because when you're in there testing, you've heard my videos over and over and over, and you'll actually start out, "Hi, Miss Jones, my name is Patty. Paulette." Okay. So when I say that as long as you know your name, some of you aren't even going to know your name for the test, and that's okay. We're going to get you through that too. Okay. It's okay. So for the test, when you go in on testing day, our closest testing center is now in, and all of this stuff is here for you. You guys can go through this. This is all up here for you to be able to refer to. It's also in your book. But when you go into test, our closest testing center is now in Tampa. We had one in Newport Richey. They closed down 2 months ago. So we don't have a local testing center. Tampa is our closest now. When you go into test in Tampa, you're not going to be testing with the people in this room. Everybody registers independently. Depends on how long it takes for them to process your application. So you will all be testing usually at separate times. They test 8 people a day, 7 days a week. Now, the testing center that I recommend that you go to, the one by the airport, actually tests 16 people a day. Okay. So you're going to be going in with a group of people you don't know. And when you go into the testing center, you cannot take any electronics in. So if you've got a smartwatch, you cannot wear it. You cannot take your phone in. The only thing you're allowed to take in is your test admission letter and 2 forms of ID. And if you didn't print off the test admission letter, that's okay. Not everybody has access to a printer. You don't have to take that, but you do have to take 2 forms of ID. Now, one of those forms of ID has to be government issued with a picture. So a driver's license, an ID card, a passport, or a military ID, and it has to be unexpired. They cannot use an expired one. So an unexpired government issued ID with picture. Okay. The second form of ID just has to have a signature. So your social security card, a debit card, but it's got to have the same name on it. So if you have 2 different names, like you got married and you've got your driver's license in one name and your social security card in another, that won't work. They have to have the same names. Okay. So you go in, they're going to verify your identity. They want to make sure that you are you and you're not testing for your sister or something, right? So once they check everybody in, those 2 evaluators are going to disappear for about 45 minutes. And you're going to be like, oh my gosh, what's going on? Let's get this thing started. Because remember, you have no electronics. So you're sitting there staring at 7 other strangers. It's a bit awkward. But they finally come back in, and then they're going to break you up into groups of 2. Now, this is not random. I'm going to make it random for our purposes in here, but they're going to break you up into groups of 2, and it's not random. So you 2 are group 1. Don't go anywhere. You 2 are group 2. You've got about an hour to kill. So go grab a cup of coffee somewhere. You can go to your car and study. Remember, you can't have study material or electronics in the room, but you can in your car. So go to your car and study, but be back in an hour. You guys are group 3. You've got about an hour and 45 minutes to 2 hours to kill. So, go Target clearance shopping or something. Don't sit there and rack your brain. You guys are group 4. You've got about 2.5 hours to kill before you have to be back. So Chili's, 2-for-1 margaritas. We'll see you in a while. So you guys are group 1. You're going to be brought into the testing center. Now, this is a closed off room. No one else is in there. So if I put a wall right here, like where the camera is, if I erected a wall right here and put a door in it, this would be your testing center. It would be private. Nobody can see or hear what's happening in this room. And there's 4 people in the room, you and you, because you're getting ready to test, and 2 evaluators. Now, those evaluators are going to show you around because you have no idea where anything is in this room. So the evaluators will explain to you where everything is. So this is your 3-drawer unit. In here, top drawer, you're going to have your grooming supplies. Middle drawer is bathing supplies. Bottom drawer is toileting supplies. Grooming, bathing, toileting, just like the body. Okay. This is your hospital bed. Call light is here. It just holds the call light until you need it. Gloves are up above. This is your dirty linen hamper. This is your clean supply shelf. So you've got pillows, sheets, towels, chucks, blankets, patient clothing. And then this is what we use for our privacy curtain. If you notice, it does not go all the way around the bed because you're being tested and we need to see what's happening in there. So we're just going to close it as far as it will close. This is a simulation because they still need to see. Good. This is the patient bathroom area over here, sink with hot and cold running water. You got paper towels on the wall, and you've got a patient toilet, looks suspiciously like a bedside commode. So once they show you all around, they're going to pick one of you 2 to go first. Well, ladies first. So can you give me a number 1 to 11? 11. So the computer randomly picks skill set 11. See, the evaluator doesn't even get to pick your skill set. The computer picks it when you register. It's actually coded into your ID. That's to help prevent bias. Because what if you park in the evaluator's parking spot? That's not going to start you off on the right foot, right? And they're going to give you the hardest skill set they can because you parked in their spot. So, to help prevent against bias or prejudice, the computer picks your skill set. The evaluator does not. So the computer picks skill set 11 for you. So let's find 11. And your skills are measure and record pulse, change position to supported side lying, and provide foot care. These 3 skills need to be done in the order listed, and they're actually going to read the care plan itself to you. I'm not going to do that right now, but and then they're going to hand this to you. Now, they're also going to tell you how long you have to do that set of skills. So you would have 34 minutes to do those 3 particular skills. So we'll get into skills timing in a future lesson, but that's plenty of time, way more than you actually need. Our students don't time out because you have a clue what to do. People that time out are the ones that have to start over and over and over and over because they don't know what they're doing and they're trying to make it up as they go. My students have a basic understanding, so we don't time out. I haven't had a student time out in like 10 years. That's not an issue for us, but they'll tell you how long you have. And then when you get to 29 minutes, they're actually going to tell you 5-minute warning. So you know that you're getting close on time. So you can kind of, put it in sonic mode, speed up a little bit. All right. But in order to do I'm sorry, let me back up. So they read these to you, they give them to you, they tell you how long you're going to have, but your time has not started yet. You're going to look that over. You're going to think about it. I don't know what you have to think about, but you're going to think about it because all you're doing is reading and following, but think about it. And then when you are ready, you're going to tell them, I'm ready to begin. So your time has not started yet. You tell them when you're ready. But now that you're ready, you need somebody to do those 3 skills on, like measure and record pulse. I mean, the mannequin is good, but she's not that good. She does not have a pulse. You need a live human for that skill. and you are sitting around with nothing to do. So you will become the patient for her to do her 3 skills on. Now, there are some skills that just a little too personal. You're not like dressing, we're not going to dress one of you guys. The mannequin will fill in for 4 skills, and I'm going to tell you how to know the difference in a little bit. But 4 skills the mannequin will fill in, but the rest of them are done on live people. So when you are the patient, you are going to get a script, and you have to follow that script. So you're going to be pleasant, cooperative. You aren't there to make it hard on the other person testing, because they're about to be your patient. Think about that, right? You are to be pleasant, cooperative, and you. So I don't know why this is, but students are hilarious, right? For whatever reason, when you play that role of the patient, you want to turn into a 90-year-old invalid, right? So if you're going to walk somebody, they try to ham it up. Don't ham it up. Be you, right? So if I'm walking, I'm walking. This is how I would walk for the test, right? The same way I walk every day of my life. I'm not going to walk like this. Don't do that. Okay, be you. Just a pleasant, cooperative version of you. Okay, so you will be the patient for her to do her 3 skills on. You don't know what your skills are yet. So you're laying there being a patient, and your brain is just going, because you don't know what you're getting. You're just like stressed. But you'll be paying attention to what she's doing, and you're in your mind, you're going to be like, oh my gosh, she did that wrong. Oh my gosh. Don't try to help her. Do not try to help the person testing. You're going to want to. You're going to be like trying to give them hints. Don't do that, because that can disqualify both of you. Okay? Super important. Be a patient that doesn't know anything. And then when she's all done with hers, you'll get your care plan. And it probably won't be the same care plan. Because remember I said when you get checked in, they disappear for like 45 minutes and they come back and then they pair you up and it's not random. Well, that's what they were doing for that 45 minutes. And it takes a while. It's not as intuitive as you would think, because when you checked in, you told us you just had some dental work done. And when you checked in, we asked you, do you have any health problems that would keep you from being a patient for any of these skills? You said, yeah, I got some athlete's foot on my right foot. And when you checked in, you said, yeah, man, I was jumping on the trampoline and fell, and I got a shoulder that's just like really hurting right now. So you all come with your own issues, right? So if she's got range of motion, did you have range of motion? No, you don't. Oh, provide foot care. You cannot be a patient for that because you got some athlete's foot going on. Right? So she is no longer a patient. She's going to change position to support a sideline. I have to find somebody her body size or smaller for that. So there's a lot that the evaluators have to take into consideration when they're pairing you up for these skills. Don't make it unnecessarily hard for them, but please let them know if you have something, because this has happened before. Somebody that just had dental work done the day before the test didn't tell the evaluator. And the CNA, the person testing, was brushing teeth, just happily brushing teeth, and all of a sudden blood erupts, right? That is not what the evaluator wants to deal with, ever. So let me tell you a secret about evaluators. These are RNs that have been in the workforce forever. They're old school nurses like me, right? They know how to make a hospital corner, let me tell you. They're old school nurses. They've done their time in the trenches. They want to be at home in their pool, drinking their Mai Tais. They do not want to be watching you wash your hands for the 6th time today. But they can't quite retire yet, so here they are. Okay? Evaluators get paid by the day, not by the hour. That's important. That is important. Because if you take a long time, you are what's standing between them and their pool and their Mai Tai. They are not going to be your best friend. So you need to do this with a little intention. Okay? Understand those evaluators do not want to be there. They're nice enough, but it's not really where they want to be. They want to be at home. You are what's standing between them and their pool. So their job is to get you tested in and out so they can go home. Make sense? That's going to be important as we go through this. So when you're not telling them things and you're causing issues and situations that are just getting in the way between them and their pool, it can make them a little grumpy. So if you've got dental work, let them know. If you've got athlete's foot, let them know. If you have a prosthetic limb, please let them know. And yes, that is a story. We were a testing center here for 4 years. And one of my students, this is a long time ago, she had a prosthetic. She had been in a motorcycle accident, lost her leg above the knee. She'd had a prosthetic. I didn't know for like half of the class, because she walked. I mean, she accommodated great. And I can't see through your scrubs, right? I had no idea. So about halfway through the class, she lets me know she's got a prosthetic, and oh wow, that's pretty cool. So I didn't think to tell her to let the evaluators know. It just didn't cross my mind. So I'm going to tell you, if you have a prosthetic, let the evaluators know, right? So she's in testing. Now, the person, she didn't let the evaluators know. The CNA that's being tested, she's the patient. CNA being tested got range of motion, hip, knee, and ankle. Now, when you lift a leg, you expect a certain amount of weight to it. Prosthetics are titanium, super light. So the CNA being tested put her hand under, lifted with some intention because she expected some weight there, and the prosthetic leg came off. The person testing dropped the leg, fell off the bed, clattered to the floor. She starts crying. The evaluators has no clue what just happened. I mean, just standing there going, trying to piece it all together. And my student is laughing hysterically. But the person testing had a hard time recovering from that, right? Because you're nervous. I get it. You're nervous. But please let them know when anything out of the ordinary may disrupt the test. Another one. So feeding is one of the testable skills. You might actually find yourself being fed for the test, pudding or applesauce. Well, this student, the person playing the patient, was allergic to, I think it was wheat. It was something in the pudding. It's either chocolate or wheat, or there was something in the pudding she was allergic to. She didn't tell anybody. She just sat down and ate the pudding. She knew she was allergic, but like 2 bites in, her face starts to get red and swell. And the evaluator's looking at her going, that doesn't look right. And the person being tested is like, that doesn't look right, but just keeps feeding. So yeah, they had to stop that test, get the girls some epi, and just a mess. So, and she's like, well, I didn't know what to say because it was a test. I just figured I had to eat. No, you don't. If you have an allergic condition that's going to stand in the way between that evaluator and her pool, please let them know. Okay, good. So when you are doing the skills, okay, So let me take this back real quick. So you have your 3 skills that you're going to do. The evaluator has a checklist, and this is the checklist that they're using right here on the back. So you can practice with this. These are the skills. These are the checklists. And as you're doing the skills, every step you do right gets a check mark. If you don't do a step, no check mark. If you do a step wrong, no check mark. You only get a check mark if you do it right. At the end of the test, when you're both done, the evaluators are going to take the checklist, go over to the computer, and they're going to put in everything without a check mark. That's called a deficiency. Now, the computer is the one that's going to figure out, based on what you missed, whether you passed or not. The evaluator does not fail you. The computer does. And that's because every step is going to have a different weight to it. So let's talk about this lady over here. Let's say that one of our skills is brushing teeth. And you're going to do that on a live person, but we'll just have her stand in for a minute. Is she in a safe position for mouth care? Why? Okay, and what could happen? Yeah, so she could choke or aspirate. Yeah, sure. So we know that's not safe, right? Do you think that's pretty important? Like, if you kill your patient for the test, do you think you're going to pass? No. Yeah. So that's pretty important. Now, I don't know if you've ever brushed somebody's teeth. Like, when you brush your teeth, I'm hoping you did so this week, right? Everybody brush their teeth this week? Good. So you're familiar. So if you stand over a sink, you probably stand something like this. And you do that because you're going to get a whole bunch of foam in your mouth and it's going to dribble, and it's not a neat and pretty process, right? So you want whatever's dripping to drip into the sink. When your patient is sitting in bed, they're sitting like this. So where's all that stuff going to drip? Yeah. So nobody has died from toothpaste on clothing, but we could probably remedy that, right? We can put a towel over their chest to catch any of those drips. So that's a step. Putting a towel over their chest, that's a step. Kind of important. I don't want to walk around with toothpaste on me. Kind of important, but has anybody ever died? So which one of those steps do you think is going to count more? Putting the head of the bed up or towel over the chest? Yeah, because it can kill your patient. The potential consequence to the patient is much greater. So every step in the skill is going to be weighted depending on the consequence to the patient if you skip that step. See, here's one of the secrets to the test. The test is not about you. You think it is because you're there to test. It's your name. I'm testing. You think it's about you. It's not. A test has nothing to do with you. Nothing. Those checkpoints have nothing to do with you. Those checkpoints have everything to do with the patient. And if you can make that flip in your brain, if you can start paying attention to the patient instead of you, you will do fantastic for the test. It's about the patient. It'll never be about you, ever. None of those checkpoints are about you. Did you put the head of the bed up? That affects the patient. Did you wet the toothbrush before you put the toothpaste on it? Have you ever tried to spread dry toothpaste over teeth? It's all gloppy, sticky, icky. Don't do that. Put the toothbrush first, because there's a potential consequence to the patient. Good? Make sense? Did you wear gloves? That's not for you. Who's that for? The patient. You're putting your hands in their mouth. Glove up, please. Right? Make sense? Good? Questions?
Do you know where you pass something?
So we're going to talk about that. Yeah. So you get, let me go back. So you do the skill, the evaluator checks everything off that you do right. They put all deficiencies into the computer. Computer does its little calculation thing, beep, 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 beep. And at the end of the test day, you'll get 2 printouts. Those printouts will tell you, yes, you passed the skills. Yes, you pass the written. As long as it says yes on both, you are now a CNA. You will find out at the end of the day. But the evaluators cannot discuss those results with you. They're going to hand you the papers as you walk out. And they're not going to talk to you about it because they're not going to get into an argument with you. Those are your results. Take them. If you want to file a complaint with the Board of Nursing later, you can. Feel free to do so, but they're not going to argue with you. Okay, good. So these are the results. This is what you would get. So this is the results of the written. And again, this is all up there for you. This is what the written results look like at the top. Written in this, yep. So at the top, thank you, I forgot to go over that. So at the top, it tells you pass or fail. Down here, it tells you the categories of the questions, how many were in the category and how many you got right. Okay. It's not unusual for my students to get 100%. I'll make sure that you're well prepared. What's that?
That's what I'm talking about.
Yeah, I'll make sure you're well prepared. The second one, we'll talk about the written a little bit more in a few minutes. The second one is your skills results. Now, this one actually has 3 pages. And I don't know why. They could work on formatting and get it down to 2, but I'm not Prometric. So this one's 3 pages. This tells you at the top whether you passed or not. And then down here, you see some of your skills, and then it goes over to the next page where you see the rest of the skills. So what was on that skill set is what you're going to see here, along with 2 additional skills, which we'll talk about in a little bit. And then you get that 3rd page. Now, for me, the 3rd page is the most important one. I know you're looking at, you want that passed, right? Pass. That's important to you. But for me, this is the important page because I know you're going to pass. To me, I don't have any concerns there. This is what I'm concerned about. And the reason is these are your deficiencies, everything that they did not see you do or that you did not do properly. Remember I said the test is 40 minutes out of your life, right? I'm going to be the body in the bed one day. This is everything you missed. This is what's going to matter to me when I'm the body in the bed. It's not enough to pass. If you miss stuff, you need to read this and figure out why you missed it, because tomorrow is when it's really going to count, when you're doing it on a real live human. Right? They don't want you to miss this. Trust me. Good enough is not good enough in medicine. Does that make sense? I would prefer, if I were running the world, you wouldn't be able to get your CNA if you had any deficiencies. I mean, let's face it. Do you want a surgeon that just barely scraped through? That's not the guy I want working on me. And yet, what do you call the doctor that graduated with a D? Doctor. Oh, yeah. So for me, this is the important page. You need to read it. Don't just throw it in the backseat of your car and speed off and go, woo, I passed. That's great. Yay. What'd you miss? Because you need to improve here. Now, if you don't get a 3rd page, oh, you're my student. That means that you didn't miss anything. No 3rd page, perfect score. And that's what I'm going for, because I'm going to be the body in the bed. Good? So speaking of body in the bed, we are going to take a break here in just a few minutes. I know I talk nonstop for 4 hours, but I do give you a 15-minute break in there. But I do need to talk to you about Wednesday. I have a problem on Wednesday. I have done something to my knee. It hurts really bad. And the only doctor appointment that I could get is on Wednesday. And I had to wait 4 weeks for this appointment. So I have to go, and I don't have a substitute teacher. I am it. This is my domain. I am it. So we have a couple of options. Okay. I have to leave here at like 10:45. So if you want to come in for an hour and 45 minutes, that's fine. Or we can move the class to tomorrow. I know some of you have work issues. That's fine. Or we can move the class to later on Wednesday, after my appointment. That's fine. I'm open to suggestions. I don't want you guys to have to miss time because of my issue. So if we meet on Wednesday, regular time, you're only going to get an hour and a half. You're going to miss some time. Okay, so I'm going to kind of let you think about that on break. And at the end of class, we're going to take a vote, and it's just going to have to be majority rules. That's really all I can do at this point. And I do apologize. I don't like my personal issues to interfere with class. I do everything I can to avoid that. And I do apologize, but I'm kind of at an issue here. Has to be addressed. Okay, so we are going to take a break, come back about, let's come back at 11. I'll give you 14 minutes. You can eat and drink in this room. So if you guys want to run out and grab something to drink or something to eat, that's fine. If you're a few minutes late coming back, I'm not that kind of a teacher, guys. I am not that kind of a teacher. Just come in when you get here. Okay, so if you want to run out and grab something, that's fine. We'll see you back here at 11. Yes,
What is the difference between CNA and PC, whatever they are?
we'll talk about that in just a little bit. Ask me again after break
Okay.
and I'll cover it. Testing. Okay, it does look like it's coming through. Testing. Okay, does anybody have any questions for me so far? Okay, so the question is, what is the difference between a PCA or a PCT or a temporary nurse assistant and a CNA? There's a lot, like I said, alphabet soup out there. There's a lot of difference. So, or a lot of confusion on the difference. So in order to understand this, we have to kind of go back to our role. Okay. Because on the surface, they look alike. PCAs can brush teeth. CNAs can brush teeth. PCAs can walk patients. CNAs can walk patients. So on the surface, they look alike. The biggest difference between them is that while other modalities can do, CNAs have the additional training to observe and report. So a big part of what we're going to learn in this class is normals. So normal aging process, normal disease process, normal vital signs. We're going to learn normals specifically because we have to, once you know normal, we have to train you to look for abnormal, right? Because remember, a big part of our job, half of our job is to observe and report. That's what sets you apart. Home health aides, temporary nursing assistants, PCAs, PCTs, they are there to do. So physical actions are the same, but they don't have that additional training in knowing normals. That's what sets the CNAs apart. That's why you have to be certified. Now, this also applies to the difference between LPNs and RNs. Now, I was an LPN for years before I went on to get my RN. And if you asked me back then, I would have told you, I do everything the RN does. You know, I don't understand why I get paid less because I do the same stuff that they do. And that was true. That was true. LPNs and RNs do the same tasks. RNs have a few additional tasks they can do. But what sets the RN apart is something invisible, something you can't see. And that's the ability to assess and look for real problems and potential problems. That's not something you can see. It's invisible. So on the surface, they look alike. But the RN has that additional training that gives them the ability to go beyond that. Does that make sense? So even though home health aides or PCTs or patient care assistants, I mean, there's a million different terms out there now. Even though it looks like they do the same thing, the difference is invisible. It's not something you can see. Does that make sense? Good. Okay. All right. Okay, so your blue books that you have in front of you, you have a B with a number on it next to, or up in the upper right-hand corner. When I call your name, if you can tell me what that, letter number is, like B1, B2, B3, whatever. When I call your name, if I say it wrong, please correct me so I can learn it. But guys, it takes me about 4 weeks to learn all of your names, and by then you're gone. So, and I've been doing this a long time. There's a lot of names rattling around up there, and I'm getting older. So bear with me. I probably will ask your name several times during the program just because I'm trying to learn it, but I'm just not as good at this as I used to be. I'm sorry. But if I pronounce it wrong, let me know. And if you want to be called something other than what I call you, let me know that as well. Okay. So Yashini? Just Jenny. So Jay?
Yeah.
Paulette?
E1.
Taiwan? And do you want to be called Ty? Jordan? Brianna? Lauren? Ashanti? Is it Ashanti or Ashante? Okay. Freddie? Savannah? Daniela? Donald? Tracy? And Brittany. Bingo. Okay. All right. So any questions on what we've gone over so far? Is anybody lost? Am I going too fast? Am I going too slow? All right. So we're going to move on. So far, we have learned that CNAs do routine tasks on stable patients according to the care plan. That our entire job is to follow the care plan, the whole care plan, and nothing but the care plan. And half of our job is observation and reporting. So remember, that's the important half. Yes, we're there to brush teeth, but while we're brushing teeth, we should be looking for abnormalities to report, right? So you should never be in an adversarial relationship with your nurse. Let me tell you, I've been doing this a long time. If it's you versus the nurses, right? If it's an adversarial relationship, do you know who's going to lose? The patient. Every time. It needs to be you and the nurse on the team that's fighting whatever's trying to kill the patient. Because if you're too busy fighting each other, nobody's fighting what's trying to kill the patient. It's that simple. So if you're in a position where it's you versus the nurse, then you need to find a different position because you're not doing anybody any good. You're just not. Sometimes that's the nurse's fault. I wish I could stand up here. Oh God, I really wish I could stand up here and tell you that every nurse you were going to work with was awesome. Cream of the crop, in it for the right reasons. I wish, with all of my being, I wish I could tell you that. But it's simply not true. It's not. There are bad servers at Chili's. There are bad cashiers at Walmart, you know, when they actually have cashiers. Right? There are bad people in every single job out there. And nursing is not immune from this. There are bad nurses as well. I really wish I could tell you it was different. But remember, the one thing I want you to remember out of anything else is if it's you versus the nurse, the patient loses. Every time. Every time. You're not doing anybody any good there. You might be collecting a paycheck, but you're not doing anybody any good. Well, there's a couple of, so I'm trying to figure out how to say this without sounding mean. The first thing you need to do is look at you. I've been guilty of this. I mean, we all have, right? There's days you go in there with a chip on your shoulder. So the first thing you have to do is look internally, look and see, is it me? Do I truly understand my role here? Am I operating within my scope of practice, or am I trying to be a nurse that's causing conflict? So that's the first thing you kind of have to look at. Second thing you need to look at is the environment, right? Am I like part of a clique? Am I, you know, my work ethic not good, you know, that type of thing. So always look at you first. Now, if you can rule that out, you know, if you change a few things, tweak a few things, try a little harder, whatever, try to rule that out. If it's very obvious, okay, it's not me. If it's not me, it must be you, right? Then I personally would try the direct approach. Hey, listen, we're off on the wrong foot here. I don't know what it is. I don't know what happened. But all I know is that if I'm busy fighting you, we are not busy fighting whatever's trying to kill the patient. So can we get on the same page here? What do we need to do to work this out? I favor the direct approach. I think that it solves a lot of problems, but make sure that you're right first. Okay. If that doesn't work, you've got two options. I'm not a confrontational person. I don't like confrontation. I will be direct. Direct is okay, but I'm not confrontational. So if that didn't work, if I looked at me, I'm okay. I looked at them and I was direct. I don't think that we're okay. What can we do? And that didn't work. I can go to the next person up in the chain of command and I can say, hey, this doesn't work. We're not getting along. The patient is the one suffering. I don't think that this is a good, healthy working environment for the patient to be in. Now, a lot of times the manager can solve the problem. Sometimes the manager can put you on a different shift or a different hallway. Guys, there are personality conflicts everywhere. I have been in line with people at Winn-Dixie that I didn't like. I mean, I've seen them for 2 minutes of my life, right? But I immediately know, no, don't like you. You know, it's whatever. There are personality conflicts. We have to recognize that. There are people that just do not mix well. That's okay. It's okay. Right? So if the manager is a good manager, they can move you around, try to solve the problem. If you are not a confrontational person, chances are once you get past the direct, so it's not me, must be you. So let me go direct. Can we work this out? A lot of people at that point will just leave and find another job. If you're not a confrontational person, that would probably be your answer. There are no shortage of CNA jobs out there. Oh my gosh, they're offering sign-on bonuses in places. There are no shortage of places for you to work. So that's not really an issue. If you're not happy where you are, you can certainly go elsewhere. It's not like you can't find a job. You're trapped in an unhappy work environment. You can go elsewhere. But I would encourage you. Remember I said at the very beginning that continuity is important to pick up changes in patients, right? So if you can work it out, I would encourage you to try. But I'm not going to be a hypocrite and stand up here and say, I've never walked out of a job because of a personality conflict. I did. Absolutely. I tried to work it out. It was not work outable, and I didn't feel like going to the supervisor. I left. So yeah, I mean, that is one way to handle it. I mean, I got a different, better job out of it, you know, that I went somewhere else. But yeah, I have left a job because of my coworker. Got to solve the problem however is best for you at the time. But please keep that saying in mind. If it's you versus the nurse, the patient loses. Okay. So in a perfect world, which if I were running it, it would be that the nurses appreciate the efforts of the CNAs and the CNAs understand that the nurse fills a different role. See, where a lot of this comes from is, and I'm plugged into a lot of Facebook CNA groups, a lot of Facebook CNA groups, and I see this every day. This is one of the reasons I do my live weekly show, is because of this. I'm trying to elevate the image of the CNA and get you guys to work together, right? But a lot, I see it a lot, that a nurse hunted me down to tell me a call light is going off. Well, the nurses can answer call lights. They should answer call lights. But if the nurse is trying to arrange for a PET scan on a patient that just had their last chemo session and can't be discharged until the PET scan comes back clean, and we've got 4 people waiting on that bed, then scheduling that PET scan is actually kind of important. If they go answer that call light and it takes that patient 15 minutes to get out of bed and to the bathroom and go to the bathroom and get back up and get cleaned up and get back to the bed, that means that that PET scan may not be scheduled because that position, that slot was taken in that time. Does that make sense? So you need to understand that nurses and CNAs fulfill two different roles. So if you're judging the nurse based on your role, it's always going to look lopsided. Does that make sense? So if you have realistic expectations, like I said, in a perfect world, I would have nurses that appreciated CNAs and CNAs that understood that there are different roles. That's how you prevent conflicts. Good. We also have to understand, and remember, I'm not trying to minimize a CNA here. Your role is extremely important, but we also do have to understand that our name tells us a lot, right? Certified nursing assistant. So if you're putting yourself on the same level as the nurse, things are going to get a little wonky because now you're making decisions. And who does that harm? The patient. It also is going to harm your relationship with that nurse. Does that make sense? Okay. So as long as we understand that, man, we can usually get along with anybody in our work environment as long as it's not cliquey. Be careful about cliques. Try to avoid cliques in your, your work environment. I don't really have a solution for that. People are just generally cliquey, but try to avoid it. Okay, good. That's like in here. I love my students. I mean, you guys are like awesome. I love being able to take brand new people and mold them. And at the end of the program, you're going to want to go out and celebrate. You graduated. This is awesome. And you'll invite me along and I'll say, I'm sorry, no. And it's not because I don't want to be with you, but it is because we need to maintain that professional boundary. It's not that I don't appreciate you guys and your accomplishments. It's that professional boundaries actually mean something. And I'll celebrate for you, but I'll do it separate. Okay. Does that make sense? You need to remember that in the workplace. If you're working with people and then you're going out to Chili's with them afterwards, those professional and personal boundaries can get muddy. And then problems usually happen. Okay. Good. Just something to think about. All right. So how are we going to get from here to there in 4 weeks? And how are we going to learn all of these skills? I mean, that's not much time to learn all of these skills that we have to learn and be able to pass the test at the end of this, but also be able to function in a clinical setting as well. Well, if you look on the back wall, you'll see a bunch of very colorful banners. Now, this really is the foundation of our CNA program. And this is what we're going to be learning. In fact, by the middle of next week, we're going to have all but 2 of these memorized. All but 2. Now, I'm not going to give you a whole bunch of flashcards and make you memorize all this. I'm going to tell it to you in a way that makes sense. For instance, out of those 11, you've already learned 1. You've already learned 1. Perform the skill as directed on the care plan, the whole care plan, and yep, you're going to report all observations to the, you've already learned it. That wasn't hard, was it? Okay, I'm going to do the same thing with the rest of them. I'm going to present the information in a way that makes it intuitive. Remember, I said at the very beginning that you're going to learn this, but it's not going to feel hard to learn. That's because of the way I present this information. Because if you try to memorize something, it's only going to last as long as it's useful. And then it's gone. if you learn something, not memorize it, learn something, then it'll stay with you forever. That's the difference. So my job is to get you to learn these principles so that they last way beyond the test. Good? Make sense? Okay. So today we're actually going to learn 2 more. So by the end of class today, you're going to be able to recite 3 of these banners for me without really even having to think about it too much. The last one's going to be a little bit rocky. You're going to need to go home and practice it a little bit, but we'll get there. Okay. So if you remember, I said that, let me pull this up here. You guys remember this? These are the test results from your clinical skills. And you've got 2 skills down here, and the rest of them are up here. And there's 5 listed. You guys remember that? Okay, so 3 that were on your care, whoops, 3 that are on here. So what are the other 2? They're what we call hidden skills. This is called indirect care. That's one of them. And hand washing is the other one. So we're going to learn hand washing in a little bit. It's graded separate. But indirect care is something that is a little harder to define, harder to explain. I'm going to get to that in about 45 minutes. I'm going to explain indirect care in detail to you. But everything that I'm going to teach you, all of these principles here are going to make up the skills, and they're all repeatable. So the opening is what we're going to learn now. And the opening has to be done before every single skill we do. Every one. Doesn't matter what we're doing, the opening is the same. So it's one set of tasks that under one umbrella is called an opening, but it's always the same. So we can do the same thing with washing rules. We can do the same thing with glove rules. We can do the same thing with shoe rules. And we can do the same thing with the closing, which is how we're going to end every skill. They're repeatable steps that are common throughout many skills. So the good news is you only have to learn 11 to be a CNA, and we've already got 1 down. Okay, easy, easy. Yeah, we're going to go through one of those now. So if you turn in your white book, the page 20 in your spiral book. Oh, let me stop here. I do forget this. I tend to jump in here. Okay. So let's talk about your syllabus first. This is how we're going to get from A to B in 4 weeks. So the first column you'll see are things we're going to do in class, that class period. So we just learned skill rules. You guys remember skill rules? We've learned that. So you can check that one off. Done. We're about to learn the opening. We're also going to learn the closing. We're going to learn hand washing and indirect care. I still have 1 hour and 35 minutes. So a lot to do in that time frame. But if you look down to Wednesday, you'll see that we're going to learn how to remove gloves, how to perform mouth care, dressing a resident with a weak arm, and pulse. So we're actually jumping into skills on Wednesday. But each class period is going to tell you what we're going to do in class that day. Please note on Monday, you need to bring your blood pressure and stethoscope with you. And if you can, bring some sort of a can, like a hairspray can or something. Lysol cans work really well. Something about this big. I have, I think, 9 of them. So if a couple of you could bring them, that would be good. But we're going to use this to practice inflating and deflating our cuffs rather than your neighbor's arm, because they will thank you. Okay. But you can see what we're going to do in class. Now, this is helpful if you can't come to class and for whatever reason you can't do the Zoom either. this lets you know what you've missed in class so that you can review those topics. And I'll give you the resources in a minute to review. Okay. The second column, these are kind of my classroom lectures. So things we're going to talk about in class. If for some reason I don't get to that, this is something you probably need to read on your own. So we've already covered what to expect on the CNA exam. So you can check off that first one. We've talked about testing care plans. And we talked about the banners on the back wall. So let's puzzle this out. We still have to talk about delegation. I'll talk to you about that in a little bit. Now, the third column is the dreaded homework. Nobody likes this. I get it. I don't like it either. But your blue book is your homework book. So you're going to go home tonight and read chapter 1 in the blue book. Leave that blue book at home. We don't work out of that in this class. That is strictly for homework, additional reading. So take it home, leave it home, use it for homework reading. You're going to bring it back on the last day. I do collect these. You'll never need it again. Do the reading, get through it. You'll never go back to that book again. Okay. The white book, though, that's the book we work out of. You're going to bring that back and forth to class every day. In fact, you probably need to be sleeping with the white book. Okay. Have it next to you when you're eating. This is our main book. All right. It's also the one I wrote, which is important because I'm the one teaching you. If there is a discrepancy, and there will be discrepancies between the white book and the blue book, always go by the white book. It is geared specifically for prometric testing, which is what we have here. The blue book is generic and wrong in a lot of places, but you're going to do your homework reading. I'll tell you where it's wrong as we get into it, okay? But if there's a discrepancy, which one do you rely on? White book, okay? But you are going to read this because the blue book has stuff I don't go over in class. I'm not going to tell you the difference between long-term care and acute care because I really don't care. Has no bearing on anything, but you need the information to be able to function in a clinical setting, okay? So you need to know the difference. It's not going to be on the test, but it's something that you probably need for real life, okay? I'm not going to review body systems with you because CNAs don't need to know. Do you think? CNAs don't think. You don't need to know body systems. Who cares? But you do need to know the signs of a heart attack because of that whole observation and reporting thing. You don't need to recognize that it's a heart attack because that would mean you're thinking. But you do need to be able to recognize that something is wrong and report it. Good? Okay. So I am in the process of redoing the spiral book. It'll be out this time next year. Man, it's a big process. I'm adding 200 pages to this thing. I'm actually replacing the blue book. So this time next year, there won't be 2 books. I told you this book is being used by schools all over the country. And that's the feedback I'm getting is everybody wants to get rid of the Hartman book. So I'm working on that. All right. So you're going to do the reading in chapter 1. Now, have you ever read something like your eyes go across a page and then you realize I have no idea what I read? No clue. Yeah, it happens to me because our brains are busy. You're thinking about a million things. It's hard to concentrate on one thing. And social media has made this really difficult because we now live our lives in 15-second snapshots. As you're scrolling, that's it. That's if you stop on something, studies have shown you're only staying there 15 seconds. We got 2 seconds to capture your attention as you scroll, and you're only going to stay for 15. Then you're moving on. That's scary. How in the world am I supposed to teach you an entire trade in 15 seconds? So the problem is, I know that this is going to happen to you when you're reading. You're going to be like zoning out, thinking about a million other things. So I need you to take a test to figure out, did you get what you needed from the reading? Okay. That's going to be in the white book. So if you turn to page 132 in the white book,
But we don't write in the blue book. You just
don't write in the blue book. Yeah, because you'll be returning that to me. So page 132, you'll see 10 multiple choice questions and 10 matching. Those are vocabulary words. So you'll do your reading. You'll take the test. Now, I've been doing this a long time, guys. I know all the tricks. Some of you are going to go straight to the test and you're going to take it and you're going to think, if I pass the test, I don't need to do the reading. Well, the test is just showing you what you know. Test doesn't tell you where your learning gaps are. The test does not tell you what you don't know. You need to do the reading because there's probably something in there you don't know that you don't know. Right? See, that's a problem with education. That's a problem with self-taught. I'm self-taught in a lot of things. Because YouTube, man. YouTube, you can learn anything, right? But there's gaps. The problem is I don't know what those gaps are. I don't even know I have a gap because all I know is what I know. I don't know what I don't know. I don't know where those gaps are. And that's where training comes in, because it's my job to tell you what you don't know and fill those gaps in for you. Good. So don't fall into that trap of just taking the test on page 132. And if you pass it, skipping the reading. Because that's not really what we're here for. Okay, good. But you take the test on page 132, that doesn't tell you anything. I mean, you take a test, great. You got to grade that test, know if you passed it. So turn to the very last page and you'll see the answer key. And yes, you can cheat. I don't care. You're going to sit, you're sitting in the chair. I don't care if you cheat. That's up to you. But I don't know why you paid $350 to sit in my chair and cheat. It's kind of a waste of money. Get your money's worth. Do the reading. Okay, good. All right. The last column is kind of iffy, right? Some things we're going to do in class, some things you're going to have to do at home. So like if you look in that last column, you'll see the care plan activity. We actually did that in class. So go ahead and check that one off. That'll be from the white book. Yes. But a couple of these we are not going to get to today. So you'll probably want to read those lessons. Good. Remember, if you go to the lesson and you see that little video clapboard, what does that tell you? Yeah, it's a video. Go watch the video. So where do you find the videos? So if you look at the bottom of the page here, it tells you to go to foryourcna.com. And you're going to find practice questions and all kinds of stuff in there. But the one that you're really going to want to pay attention to is animated lessons, which isn't written there. You're going to want to write that in. Animated lessons under training. That's where you'll get a lot of that content, animated lessons. Skills we're going to cover in here. There's skills videos on my website for review. You can go watch them if you want. So if you, for whatever reason, can't come to class, you miss a class, you look in the first column, you see what skills you've missed. If you go on to the For Your CNA website under training, you'll see skills videos. Go watch those because you'll need to make up what you missed. Look on this second thing, go read those lessons and watch the videos associated with them. But all of that is in the online course as well with interactive activities. So I give all of this stuff away for free. It's all free. It's out there for the public. I don't even get your email address. I mean, it is free. But if I'm giving all of that away for free, can you imagine what I put behind a paywall? Okay, so that online course is worth every penny you didn't pay for it. Okay, good. You want to take that online course, especially if you miss a day. So this is your roadmap. This tells you how we're going to get from here to here in a logical order. This I follow pretty religiously unless I run out of time. Now, Wednesday's class is the one day that I usually run out of time. So a lot of times I will take one of the skills from Wednesday and put it into another day. And I've got some time built in here to be able to do that. But that's usually the only day I kind of play around with the skills a little bit. Most of the rest of them I'm following like religiously. Guys, I've been doing this 15 years. I'm on autopilot right now. I mean, I'm on autopilot. So I do the same thing for every single class. Okay. Does it help you knowing that you can remote in if you need to?
Yeah.
Okay, good. Good. All right. So any questions so far? Let's go to page 20 in your white book. We're going to talk about the opening. All right. So one of the things that I want to kind of talk to you about before we get into another banner is the patient experience. So I want to talk to you a little bit about the patient, right? And if you've ever been a patient, some of this will be familiar to you, but some of it may not, even if you've been a patient. So let's think about an older person for a second. And they've been independent. They've been brushing their own teeth for years. They've been taking care of all of their own needs for years. You've never been in their life before. And all of a sudden, they have a health problem. That means that they're now reliant on somebody else. And they probably don't like that any more than you would. I mean, how would you feel if tomorrow morning you couldn't brush your teeth and you had to have somebody else come in and do it? Right? So they're probably not overly happy with their with their specific stage that they're in. Now, anybody ever been sick? Anybody ever been sick? Where do you want to be when you're sick? Home, yeah, or with mom. Yeah, that's like number one, right? I want to be on mom's couch. Chicken noodle soup, please, right? But you want to be in a familiar environment, somewhere where you feel safe. Everybody agree with that? Okay. What's your mood like when you're sick? Oh, grumpy, man. Give me what I want and go away. Don't mess with me, but give it to me now. Okay. So we don't really have the best attitudes. So the one thing that you absolutely need when you're sick is rest, right? You need to sleep. You need to rest. Okay. So we have somebody who really wants to be home, isn't happy with their current stage in life, needs to rest, and is cranky. So are we seeing them on their best day? No. All right. So now we've got this person, cranky, wants to be home, and yet they're sick enough that they can't be home. So we plop them down in the middle of a strange place. And we surround them by strangers. And chances are they're probably alone. So they're out of their comfort zone. They're cranky. They're sleep deprived because do you know the worst place in the world to get rest? Oh, yeah, for sure. Absolutely. We're going to talk about that in a minute. And they're surrounded by strangers. And most of those strangers are talking a language they don't understand, right? Because medical speak is a different language. Now, those people that they're now surrounded with are all short with them because they just want to do their job and go home. So, how welcome do you think this patient feels? Are you starting to get a sense that they may not be the bright ray of sunshine that you think they're going to be? Right? Sick patients have a right to act sick. They're the only ones that have a right to act sick. And yet, healthcare workers try to punish them for acting sick. Dude, if they felt good, they wouldn't be here. So we need to adjust our expectations accordingly here, right? Do not expect your patient to be a ray of sunshine. If you have a good patient, that is a good day. I never, ever, ever expect that patient when I walk in the room to smile or to be happy to see me. I am the last person in the world they want to see. They want to see their family. They want to see their friends. They want to see the inside of their bedroom. They do not want to see me. So if I expect a happy greeting, I have the wrong mindset, not the patient. One of the most memorable encounters I've ever had with a CNA, and it didn't go well for her, was somebody who said to me, well, she started it, meaning the patient. She started it? No, you've got the wrong mindset. So let's talk about that, because I don't expect that patient to be any sort of anything. Adjust your mindset. We're paying you to be happy. I'm not paying that patient to be nice. Does that make sense? Okay, so now that we have the right mindset, let's think about this from the patient's point of view for a second. They're in a strange place surrounded by strangers. There are people coming in on average every 17 minutes. Think about that. How well would you sleep if somebody was invading your space every 17 minutes? Now, we tend to get tunnel vision in healthcare, right? We think about our job, right? So I haven't been in there every 17 minutes. No, but the nurse, the doctor, PT, radiology, lab, billing, volunteers, dietary, and the list goes on. Every 17. So yeah, you haven't been in there every 17 minutes, but they're not getting sleep. What do you think that does to their mood? Oh man, you take grumpy and ratchet it up a few notches, right? So yeah, if you walk in the room and you give them attitude, they're probably going to throw a phone at you. I would too, right? They're sleep deprived. Now, let's take that same person, right? And they're exhausted. They finally manage to drift off to sleep. And man, they're feeling okay. No pain. They're sleeping nice. And they hear a sound in their subconscious. And it starts to, well, something's going on. And they open their eyes. And when they open their eyes, there's a complete stranger standing over them with a sharp object in their hand. How do you think they're going to react? Oh my gosh. I personally will hit first and ask questions later. Oh yeah, because I now feel threatened. So you need to understand that if we want our patients to rest, we have to have a restful environment for them. We have to have a safe space for them to be in. That safe space means that nobody should be entering that space unannounced, ever. That's how we maintain a safe space. So should you knock before you enter a room? Every time. Every time. That knock is non-negotiable. when you think about it from the patient's point of view. Good? Does that make sense? Will you forget to knock? Good. Now, on that same track, though, I want to talk to you about perceptions here. CNAs do not hurt patients. We never, ever, ever never should we hurt a patient, ever. We don't have the training, the authority, or the ability to hurt a patient, ever. But we're the only people in healthcare that don't. Nurses come in and jab needles into patients. You think that feels good? Yeah, phlebotomists will stick you 40 times before they find that vein that's like right out there. What? How are you missing that, right? EKG techs will put those little sticky tabs on you and rip off every hair you never knew you had. Radiology will put you in uncomfortable positions on hard surfaces and have you hold still. What? Doctors, oh my gosh, they go into all kinds of places that I didn't even know existed. Right? Billing? Billing really hurts. We're the only people that don't inflict pain on them. Do you think your patient knows that? No, they expect you to hurt them just as much as everybody else does. So when you go to put your hands on a patient, they're probably going to expect the worst. So how in the world can we help them understand that we're not there to hurt them? We're there to help. We have to talk to them. We have to tell them every step of the way what we're doing. I know I have to do range of motion on you. I know that I know how to do range of motion. You're the patient. You should just lay there and let me. No. If I'm going to do range of motion on you, I'm going to make you a partner in it, which means I'm going to tell you exactly what I'm doing and how I'm doing it. And I'm also going to tell you to let me know if it hurts. I should be communicating. Now, this isn't just me. This is graded very heavily on the state exam. Okay, remember those checkpoints? Remember how weighted they are? This one counts. So you have to get used to talking. For some of you, this is really hard. I don't know what to say. I don't know how to say it. It's okay. Just talk your skill out. So in here, I'm teaching you. If you watch my videos, I'm teaching them. Okay, I teach. That's what I do. So I'll tell you, okay, we're going to lift the arm above the head like you're asking a question and back down to the bed. You know, I talk it all out because you guys are learning. You need to learn how to do these skills. But do you know that if I go into the hospital and I do this skill on a real life patient in a real life setting as a real life nurse, I do it exactly the same way. Exactly. Because you know who else doesn't know how to do that skill? The patient. And they're the ones I'm doing it on. So it's probably more important that they know what I'm doing than you know what I'm doing. Does that make sense? So you talk every step out. Now, the other reason that you talk every step out remember these? Right? So where do your nurses want to be? At home, in their pool. And they're stuck here watching you wash your hands. They don't want to be here. But they have to check these things off. So you do a step and they're going to have to look down here to find that step and check it off. You've done another step in that time frame, but where was their focus? That's right. So if you want credit for that other step you did, you've got to say it out loud to the patient, because even though the evaluators may not be looking at you, they are still listening. So if you want to pass the test, you talk out your steps. Okay? Good. Told you by the end of today, you're going to be able to pass the test. keep coming back, I'll give you more. But at the end of today, you will have everything you need to pass the test. But you do have to talk it out. Okay. So let's go back to that patient for just a second. So we've got a patient laying in bed. They're grumpy, they're grouchy, they're sleep deprived, but they're also worrying. Every patient in the hospital thinks they're dying. Just ask them, they'll tell you. They do. They think they're dying. Is this gonna do me in, Doc? Is this the one? They all think they're dying. So they're self-absorbed, and they should be. They should be. They're self-absorbed. But what that means to you is that they're not listening to you. They're preoccupied. They're preoccupied with their own health. So anything, any twinge, any problem that they have, they're automatically going to think the worst. But they're also preoccupied with other things that's going to make them not as cooperative. Okay. Remember, they want to be home. But they're also thinking about things like, am I still going to have a job after this? Because I'm missing a lot of work. Am I going to be able to pay this bill? Who's feeding my cat? What is my significant other doing while I'm in here? They're thinking about these things. I don't have a cell phone charger. What happens when my phone dies? Right? They're thinking about all of this. So they're preoccupied. They got a lot going on up there. And we need to understand that if that means that we have to repeat things, then we're just gonna repeat things. We're not gonna have an attitude with them. We understand they're having a bad day, right? So they're preoccupied. But they also may have some physical ailments that keep them from being able to listen as well. Things like hearing loss, which is not uncommon in the elderly, but things that maybe aren't so obvious, like pain. Pain can interfere with your ability to listen and follow directions because it consumes you. Okay, does that make sense? So this isn't the same as dealing with somebody in line at Winn-Dixie. This is a whole different beast. And we have to adjust ourselves accordingly. So remember that sick patients have the right to act sick. They're the only ones that do. But that means that we have an obligation to be understanding of that and to give them a little bit of our sunshine, no matter what they throw our way. So I have a theory with this. I have a theory. Can't prove it scientifically, but I have a theory. I think everybody is born with a bucket of nice. I think that when you're born, you have this bucket of nice. And as you grow, you hand out your nice. Right? You smile at strangers, you hold the door open, you say please and thank you. And but your bucket of nice is finite. I mean, you've only got so much. Right? So you have to rely on other people to give you some nice back, right? If you're handing it out, you got to rely on other people to give you some to refill your bucket. Make sense? And that usually comes from our family or our friends or our work acquaintances, right? We get our buckets filled. But what happens at the end of our life when our family's all dead, our friends don't live near, and the only people that we're around are sour-faced medical workers that couldn't care less whether we're there? What do you think happens to that bucket of nice? Yeah, it runs out. That's right. So this is why we have a lot of really mean old people. They've run out of nice. Do you think being mean back to them is going to fill their bucket of nice? So the only way to get them back on even keel is to be nice to them, even when you can't stand them. So I'll give you a story about this. Years and years and years ago, when I was up in, I used to work up in Crystal River, there was an old man. He was on Every facility has this one guy that nobody can stand, right? This one patient. It's like the entire facility knows about this one guy, right? Well, this was the guy. Yeah, this was the guy, right? So I had worked on a different wing, on a different hallway, and I was floated over to this, but I knew that, I knew all about this guy, right? And they warned me during report, this guy. So I went into it knowing. So I walked into his room with a cup of pills, and I'm like, "Hi, I'm your nurse today." And I see a deck of cards sitting on his overbed table, and they were well worn. I mean, you could tell that these cards had been around the block a few times. So as he's just gruff and mean and just, why should I take those? I don't trust you. I don't know you. I mean, just, being, it's entertainment for them, guys. They're bored. Oh my gosh, they are so bored. The only way that they get any entertainment is to pick on the staff, right? So I know what's up. This is not new for me. So I looked at the cards and I said, "Oh, you play cards?" And he just kind of looked at me. He said, "Yeah." I said, "What do you play?" He says, "Poker, only game there is." I said, "Oh, 5 or 7." And he stopped and looked at me. "You know how to play poker?" "Oh, I dabble a little." "Play 5 or 7." He says, "5." I said, "Draw or stud?" "Draw." I said, "Okay, deal a hand." So he dealt a hand. And I lost. It's okay. Doesn't hurt me. 10 seconds out of my day. 10 seconds. I go in later in the day and he'd already had the cards dealt. I'm like, I was not born yesterday. You shuffle those cards and you deal in front of me. So he dealt a hand. I lost again. Okay. I'm not playing for money. Doesn't matter. Right. So I didn't go back over to that hallway for probably about 2 weeks. And I mean, by then, no one wanted to go in his room and everybody was avoiding him because he was just mean. And everybody was avoiding him. So, and I mean, the rumors were just flying throughout the facility. So I actually went in there and I said, his name was George. And I said, "Hey, George, because I know that when you're lonely and you're sad and you're frustrated and you're angry at life, you'll take it out on other people. But if somebody can show a little bit of humanity, a lot of times that can change your outlook." So I went in and I said, "Hey, George, I got a couple minutes. How about you deal me a hand?" And I did that for several days. And do you know that people quit complaining about George? So why do you think he was so mean and so angry?
Nobody paid him no mind.
Because everybody was avoiding him. So in some cases, not all, this doesn't work for everybody, but in some cases, those that are pushing you away the hardest are those that need your time the most. They're pushing you away because they're angry, they're sad, they're hurt. Turns out this guy was a world poker champion. He had no family, lifestyle, right? World poker champions are not known for their strong family life, right? He had no family. He had no friends. He had nobody. He was literally parked in this facility waiting to die. And he knew it. What do you think that would do to your psyche? Oh, it's horrible. It's horrible. So take a second to kind of think about things from your patient's point of view. Where are they coming from in life? And what can you do to connect with them a little bit? I ended up playing with this guy, playing cards with him for about a year. Just 1 or 2 hands at a time. And I learned a lot about poker from somebody that everybody avoided. You never know what your patients can teach you.
But technically, you knew how to play.
I knew, but I didn't know I had to tell. I did not know I had to tell. But yeah, I knew how to play. But you can connect. Now, not everybody's going to connect to a poker player. right? Some of you don't know how to play poker, but you can find people that you can connect to. Those are your people. Like knitting, that's not my people. I don't know how to knit. That is not my person. But man, my sister-in-law, she'd be able to connect with somebody that's really into arts and crafts because they have something in common, right? Just because they're in a facility doesn't mean that they check their humanity at the door. Does that make sense? We got to start seeing patients as people, not as patients. Good. I don't know why my phone turned itself on. Okay. So let's talk about the opening. So knocking is always our first step, never non-negotiable. We always have to knock. And that way our space becomes a safe space for the patient. So once we knock for the test, we don't have to wait for a come in. We don't have to wait for an acknowledgement. This is called the open door policy. If a door is open, we're knocking as a courtesy to let them know we're entering their safe space. If the door is closed, please don't open it. You don't know think of all the things you do behind closed doors. All the things you do behind closed doors. Trust me, there are things you cannot unsee in life. Do not open a door that is closed unless they have given you the okay. Now, if I knock on a door and I don't hear anything, I will crack it open and I'll announce myself. Hey, George, it's Patty, your CNA. Everything okay? Can I come in? If I don't hear anything, I'm going in because there may be an emergency there. But I always it's 3 strikes, right? So knock, wait. I'll usually knock again, open the door, hey, announce myself, and then I'll enter to see what's going on in there. But you need that separation. Okay, think of it like a moody teenager. Please don't walk in. Okay. So we're going to announce ourselves. And when we do that, we want to identify our patient by name and tell them who and what we are. The order of this doesn't matter. Okay. So you can tell them who you are first and then find out who they are. I usually do it the other way. I usually say, hi, Miss Jones, because that kind of sets an expectation, right? And then I tell them I'm Patty, your CNA today. For the test, there are no ID bands. There's nothing to check. You're a patient for the test. You're not going in with an ID band, right? There's nothing to check. So you want to identify your patient by name. Now, trust me. What's your name? Brianna. Your name is Brianna. So if Brianna is sitting in a doctor's office and she's waiting to be seen, and I walk in and I say, so Jennifer, how are you doing today? What are you going to tell me?
My name's not Jennifer.
Yeah. Do you really want what I've got in store for Jennifer?
No.
Okay. People have the ability to self-identify. You can tell me who you are. You would let me know if I called you the wrong name. We have the ability to self-identify, and that is the single best way of identifying anybody. The single best way. ID bands are often wrong. You can't rely on an ID band to be right, but your patient you can rely on, unless they have a reason that they can't self-identify. And we have a whole process for that, don't we? We have a nurse that does an assessment that figures out real and potential problems. This is a potential problem, and then develops a care plan that tells everybody else how to handle it with that patient. We already have that problem solved. So for the test, all we have to do is identify them by name. So, hi, Miss Jones. My name is Patty, and I'm your CNA today. Now, you can't just tell them your name. You have to tell them your title too. And this is primarily because there's a lot of people that work in healthcare, and they all dress in pajamas. And those patients don't know the difference between your pajamas and you're all in pajamas. That's how you look to them. They don't know colors. So you walking in and telling me, you are so-and-so doesn't mean anything to me. I have to know your title to be able to figure out what you're about to do. Okay. So walking in and saying, hey, I'm Patty. So Patty who? Patty the person with the cookies? I like that, Patty. Patty the person with the needle? Not so much. Right? So telling them not just who you are, but what you are helps set up expectations for that encounter. Hello? Goodbye. Okay. Yeah, they did not knock. I'm trying to find, excuse me one second, because they're at the shipping station. So, did you need help? Hi.
How are you?
She looked for a trainer.
Okay, if you go down to the next one, Jake will be happy to help you.
Thank you.
Okay, thank you.
You're welcome. Okay. So your opening is going to sound like this. Hi, Miss Jones. My name is Patty. I'm your CNA today. So that's the beginning of the opening. Okay. Once you get all that out of the way, you need to tell them why you are there. So insert name of skill here. You can say, I'm here to do hand and nail care. I'm here to give you a bed bath. I'm here to take you for a walk. Put it in any words you want to. You don't have to say it any specific way. But remember, during the test, you're going to be nervous and you're probably even going to forget your name, much less what you're doing here. So for the test, you can actually read it right off of this care plan. You can say, hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to measure and record contents of urinary drainage bag. Okay. You can do that. I prefer you make it a little more personal, but you can, if you're nervous, if your brain just shuts down, you're allowed to do that. Then you're going to ask the most important question in healthcare. Is that okay? You need permission. You need permission. Just because somebody is in a place doesn't give us the right to do anything to them. You cannot touch somebody without their permission. You just can't, even in healthcare. So let's say that, Ty, do you ever go to the movies? No. Anybody here ever go to the movies? Okay. What's your name again? Tracy. So Tracy, you go to the movies. And you go in, you get your popcorn, your big drink, you sit down, and the lights are still on, but they're getting ready to dim. And I come sit next to you and I say, hi, Tracy, I need to do foot care. You really gonna say okay? I didn't think so. You're probably gonna say, no, I'm getting ready to watch a movie. Don't know you. Don't want anybody touching my feet. Go away, right? Now, if I start pulling off your shoe and sock, how are you going to respond? Yeah. Yeah. It's going to get real quick. Okay. Because I don't have the right to touch your body without your permission. I just don't have that right. Now, it doesn't matter whether that's in a movie theater, a classroom, or a hospital. The only thing that changed were the walls and the ceiling. That right goes with you everywhere you go. You do not have the right to touch somebody without their permission, period. Full stop. So that means you've got to ask them, is that okay? Do I have your permission? I don't care how you do it, but you need to get permission to do those things. Does that make sense? Good?
She says no.
Okay, so as a CNA, we only have 2 doors in our lives. That's it. We either do what the care plan tells us to do, how the care plan says to do it, right? We follow the care plan, the whole care plan, or nothing but the care plan, or we report it to the that's it. That's it. So if you can't follow the care plan, what do? Tell the nurse. Man, I'm making that written test super easy for you. Super easy. We only have 2 doors. That's it. We follow the care plan or we report it to the nurse. What if we go in and we're assigned to do something and we don't have the right supplies to do it? What do? We only have 2 doors.
So, nurse.
Report it to the nurse. Absolutely. We don't get to decide to do it a different way. We don't get to decide to use different materials. We either follow the care plan or tell the nurse. You're starting to see how clear this is, right? So during the test, they're going to give you all kinds of like curveballs like that. You only have 2 choices, guys. Okay, good. Boy, man, that test is getting easier. Easier. All right. So once you get permission, let me go through this again. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to insert name of skill here. Is that okay? Patient says yes, because remember, the patient for the test is pleasant and cooperative, right? So they are always going to say yes, always. For the test, always. Once I get their permission, then I'm going to close the curtain. I'm going to talk about this curtain for a second. Who touches this curtain in a clinical setting? Everybody. The patient sneezes and coughs onto this curtain. The family picks their nose and scratches their butt in the elevator and then touches the curtain. Nurses come in, work with the urinary drainage bag, and then touch the curtain. CNAs touch the curtain. Everybody touches the curtain. Do we have any expectation that this thing is clean? In fact, pretty much every pathogen known to man is on this curtain because they only get taken down and physically washed once or twice a year. So in between, housekeeping is nice. I mean, housekeeping is awesome. They'll spray it down with a disinfectant spray, but that's, you know, still a lot of pathogens. So let's think about the patient for just a second. You're starting to notice the whole program is patient focused. Okay, so let's think about this guy over here. So we tend to think when we are working in healthcare, it's all about us. That's kind of where our mind goes. And we want to keep ourselves safe because of all the pathogens. You know, pathogens, they're bad guys. But we actually have healthy immune systems, and we're only there for 8 to 12 hours a day. That patient is there 24 hours a day, and they're fighting something off. So their immune system is already occupied. Who's the one in danger here? The patient. We tend to skip over that as healthcare workers. We try to put the focus on us. The person in danger here is that patient. Now, if I touch that curtain and then touch the patient, I've just transferred all of those pathogens to somebody that is at risk. Do you guys see that? That's dangerous. It's even more dangerous when you start thinking about hospitals. So in a hospital, like, guys, I am like overworked, like seriously overworked. I've been putting in 18-hour days, 7 days a week. I need a break, but I can't call up my local hospital and say, okay, I really need a break. Can I reserve room 212 for like 3 days, little R&R? Okay. The hospital is going to laugh at me. So you can't just like go to a hospital. Now I can go in through the ER, but I have to prove in the ER that I'm sick enough to get in. And 99% of the time, they're going to send me home. Usually with a script and orders to see my regular doctor, right? So I can't get even into this bed unless I proved I'm sick enough to be there. So that means that we have taken the sickest people out of the community, the very sickest, made them prove that they were the sickest, and then we put them all in one place, right next to other sick people. Are you starting to see this is not really a safe environment from a pathogen standpoint? Now, the patients are pretty good. They pretty much stay where you put them in most cases. Although, have you ever seen patients wandering a hallway? Yeah, those are pathogens on the loose. Think about it. Went to Oak Hill Hospital a couple months ago to see somebody. And in the subway line at hospital is a patient in the subway line, getting a sub, pathogens on the loose. Yeah. We'll get into that later. So we have a patient here who is sick enough and has proved they're sick enough to be here. And we put them right next door to somebody else who is sick enough to be here. And they pretty much stay where they're put, except that we go in and out of all of those places. So the weak link in this process is us. Because this patient right here, their immune system's already busy. If I give them another pathogen, it might be enough to do them in. Because they don't have the immune system I do. Theirs is already busy. Infection control is going to be a really big part of what we learn in here. This is just one small piece of it, but I want you to keep that in mind. This immune system already busy. So when would I want to wash my hands? Before I touch the curtain or after I touch the curtain?
Before and after.
Okay. In a perfect world, yeah, before and after would be good, but we got 14 patients to take care of and we're short-staffed. And that's probably not going to happen. So if I wash my hands before I touch the curtain, I now have pathogen hands to touch the patient with. If I wash my hands after I touch the curtain, I have clean hands to touch the patient with. Do you guys see that? Good. Yeah, perfect world, I would absolutely wash before and after. You're not going to have that kind of time. You're just not. Right now, there's 161,000 open CNA positions
In Florida,
in the United States. 161,000 open CNA positions. There's only 13 of you. We can't crank them out fast enough. Okay. We got a serious issue. You're not going to have time. So we have to try to figure this out to keep our patients safe. Good? Make sense? All right. So our opening sounds like this. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to, whatever. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, and start my skill. Now, if you noticed, if you paid attention to that opening, I didn't tell them who I was or what I was. I said, hi, I'm Patty. So remember I said that, telling them your title is kind of important, right?
you said I'm your CNA.
Did I say it? I didn't mean to. I didn't mean to. See, I'm on autopilot, told you. Okay, so if you realize that you made a mistake, and I tried hard not to. If you realize you made a mistake for the test, you can make a correction. So corrections are allowed. So I could say correction, I would have told them my title too. Okay, you can make corrections. You can correct things you should have said. You can correct things you should have done. You can correct the order that you do things. You can make corrections. They don't expect you to be perfect on the test. They know you're nervous, but they need you to acknowledge your mistakes and then fix them. So if you're correcting something you should have said, you can just say it. If you're correcting the order of things, you can just say it. If you're correcting something you should have done, they're going to need to see it. Good. But you are allowed to make corrections. So at the end of the skill, you're always going to hear me on the videos and see me say, I'm going to think about my skill, review the care plan, make any corrections, and then tell the evaluator my skill is done. Okay, so always stop and think, because you can go from failing a skill to passing a skill by correcting an action. Okay, good. Good. Okay, so it's one more time. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? I'm going to go close your curtain and wash my hands. So now I don't have the camera over the sink right now, and I don't have the TV to put it on. So I'm going to kind of walk you through this. I know you guys over there aren't going to be able to see real well, but I'm going to verbalize it. Okay. So now we're going to get into hand washing. This is going to be on page 23 of your book. Oops, I'm sorry. Keep going. Go to page 27. No, one more. No, one more. 31. There we go. We have a winner. 31. All right. So this is hand washing. Now with hand washing, my hands are dirty. I know they're dirty. I touched the curtain. My hands are dirty. I can touch the sink faucet with dirty hands because the sink faucet is also dirty, right? We go to the bathroom, we touch the faucet to turn it on. Dirty hands, dirty faucet, no problem. Once my hands are clean though, I can't touch that faucet. Okay. So we'll get to that at the end, but keep that in mind. Dirty hands can touch dirty faucet. I'm going to turn the water on so that it's comfortable for me. Don't try to make it hot enough to kill germs. That would be boiling. You can't wash your hands in boiling water. So we're just going to turn it on so it's comfortable. You have to wet your hands before you put soap on, because otherwise the soap doesn't spread very well. It just globs in one place. So we're going to wet our hands and we're going to get some soap. Now we want to get a lot of soap because you're actually graded on bubbles for the test. I'm not kidding. You're graded on bubbles. So you're going to put your hands together and you're going to look at the clock that's right above the sink. And you're going to pay attention to where that second hand is when you put your hands together. So we're going to start it there. Okay. So I need to rub for at least 20 seconds. So that's going to be the tops of the wrists, the backs of the hands in between the fingers, the bottom of the hand by the pinky, the top of the hand between the index finger and thumb, and the palm of the hand. So all of those areas, at least 20 seconds. More is fine, less is not. Once you've washed for at least 20 seconds, then you're going to go down each one of your nails with your thumb. Circle your nails on the palm of your hand to clean underneath, and then you're going to rinse. When you rinse, you don't want to touch the inside of the faucet or the sink or the faucet because those items are not clean. And then you're going to tap. This is the hardest part for most people. Don't shake. When you shake, water goes everywhere. When you tap, the water stays in the sink. Can you guys see that? I'm going to get whatever paper towels I need to dry my hands. If you have big hands, use 5. If you've got small hands, use 2. Nobody cares. Nobody's counting. But you only want to dry what's clean. If I go up here, did I wash up here? If I go up here and then back down here, I've cross-contaminated. So you only dry what's clean. You're going to throw that away. Get a clean, dry paper towel to turn that faucet off, because remember, the faucet is not clean. Don't use those wet paper towels to turn the faucet off, though, because wet paper towels tend to rip. you'll recontaminate your hands with the dirtiest thing in the bathroom, that faucet. Let's talk about this though. So pathogens, the bad guys in life, right? The viruses, the bacteria, the fungi, the bad guys. Pathogens need 3 things in an environment to thrive: warm, dark, moist. So bathrooms are always 2 or 3 degrees warmer than other environments because we don't like to get chilled when we get out of the shower. Bathrooms are usually dark because mom trained you, turn the light off when you leave the bathroom. So we already have warm, we already have dark. When you do this, you add moisture to the area. And that just allows little pools of bacteria and pathogens to proliferate. You walk through that, which means that those pathogens are now on your shoes and you're tracking them all around the facility, and even worse, home with you. Remember, these are pathogens that were bad enough to make somebody sick enough to not be home. Do you want these pathogens in your home? No. So by doing this, you're confining the moisture to one controlled area, the sink. This is a hard habit to break, though. And please don't do this, okay? It's not how we dry. So how long do you have to rub with friction? Minimum. More is better, but okay, remember there's 2 RNs, right? And remember they have this checklist. So RN number 1 is going to grade your first hand washing at the beginning of the first skill. RN number 2 is going to grade your second hand washing at the end of the first skill. So RN 1 is over there at the sink watching what you're doing. But RN 2 is not taking a nap. So even though RN 1 is over there watching you wash your hands, RN 2 is grading the timing. So when you wet your hands, put soap on it, they look at that clock and they write down exactly where that second hand is. And when you move to your nails, they look at the clock and write down exactly where that second hand is. And if it's not at least 20 seconds in between those 2 numbers, you fail. I don't know about you, but I would hate to go home to my family and say, yeah, I passed everything, but I failed hand washing.
I did before.
Yeah, that's a horrible thing.
It is. It's embarrassing.
Yeah, so we got to get this right. So it's 20 seconds from the time you start rubbing until you move to your nails. At least 20 seconds. And make sure you have enough bubbles. If you don't have enough bubbles, get more bubbles, start your timing again. Okay, bubbles is a big thing on the test. Bubbles.
And there is a clock on it.
There's a clock right above the sink. Yep. Yep. Good. Questions on hand washing?
So 20 seconds before you move on to nails, and then for the nails.
It doesn't matter. As long as you go down each one and you circle them on your hand. Okay. So that's the opening. That's how the opening is done every single skill. Knock, knock, knock. Hi, Miss Jones. My name is Patty, or whatever your name is. I'm your CNA today. I'm here to whatever, insert name of skill here. Is that okay? Close curtain, wash hands, get supplies. It's going to be done before every single skill you do. Now, the best place to practice this, guys, is in your bathroom at home. Send everybody else out for ice cream because you'll sound funny talking to yourself. But when you're alone in your bathroom, you've got a door to knock on. You got somebody to talk to, the one in the mirror. You've got a curtain that you can pull, the shower curtain, and you've got a sink right there to practice hand washing. So your bathroom is the best place to practice this. You know, you can write it on the mirror if you need the steps, but your bathroom is the best place to practice this. Now, I'm going to tell you, you need to practice this, and you're all going to ignore me because that's what you do as students. And then in about 2 weeks, you're going to start practicing the skills. And it's going to take you so much time because you're not going to remember the opening and you're not going to feel comfortable with it. And you're not going to, because you have to talk out loud and you're going to be stumbling all over yourself. If you practice it now, when it's the only thing you have to practice, then when we get into the skills, it makes it go that much smoother. Okay. All right. So good. Okay. So 2 banners down. 2 banners. So let's go to the closing. So just like we start every skill the exact same way, we're going to end every skill the exact same way. But man, there are a lot of steps to this closing. A lot. And I'm going to add one more that's not even in there. So the order of the opening is important. You can't tell them who you are and then knock. Right? The order is important. We have to do that in the right order. But the closing, the order doesn't really matter. At least not for the first 4. The rest of it, yes, but not the first 4. So the way that we remember this, and this is in your book on page 22. The best way to remember this is there are 6 C's to the closing. Closing starts with C, 6 C's. The first 4, we don't care about the order, but we have to address all of them. Comfort, curtain, call light, clean environment. We don't care how that's done, but you have to ask the patient, are you comfortable? They need to hear that word. Are you comfortable?
Before I start.
At the end of the skill. This is at the closing, the end of the skill. So we have to address comfort. Now, emotional comfort is as important as physical. So for the test, we're going to offer a magazine as well. Don't look too hard at that. We're not passing out magazines in hospitals. This is just for the test. But it's showing that we understand emotional comfort and the need for entertainment and distraction is important. So in a clinical setting, I wouldn't be offering a magazine, but I might be asking, would you like your crossword puzzle book? Can I turn the TV on? That type of thing. So for the test, we're going to show that by offering a magazine. So are you comfortable? Would you like a magazine? Okay. We're going to open the privacy curtain. Now, we know that curtain is dirty. That's okay. We've done our skill. We've got dirty hands. It's okay. It's okay. But we have to give the patient their call light too. And a lot of students get hung up on this. That call light is just as dirty as that curtain. Doesn't matter what you touch first. Because patients in bed scratch what itches. And then they hit the call light to tell you about it. Okay. So that call light is dirty as well. So it doesn't matter which one you do first. Give them the call light, open the curtain, give them the call light. I don't care. Nobody cares. Okay. You do need to make sure they're in a clean environment too, because patients rest better in a clean environment. Clutter tends to increase anxiety. Studies have shown that. Our patients are already anxious. Let's try to bring that down a notch. Okay. So comfort, curtain, call light, clean environment. We don't care how you address those in what order, just make sure all 4 of them are addressed. Now, part of comfort though is adjusting the head of the bed. You can ask the patient, do you want the head of the bed up or down? It's not required for the test, but you can address it under comfort if you'd like. The bed itself, the whole bed level, needs to be in the lowest position. That is not comfort, that's safety. So head of the bed, comfort. Entire bed, safety. And we're going to get into that a little bit
Right, 'cause
more.
I thought you only put the bed low when the patient is like rich fall and they fall.
No, we're going to talk about that Monday. We're going to talk about the bed position specifically on either Wednesday or Monday, I'm not sure. Bed height and low position, that's going to be safety always. Okay. So call light, curtain, comfort, clean environment. we're going to address. Make sure the bed is in the low position. Now, once you've done all that, we know we have dirty hands, and we touched everything in that. We touched a patient, we touched the call light, we touched a curtain. We're dirty for sure. So we need to go clean our hands. There's another C. So we're going to go clean our hands. So think of cooties, right? We got lots of patient cooties on us. We've got to get those cooties off. And then if documentation is required, if we're going to chart something, another C, if we're going to chart something, we would do it after we washed our hands. Good?
Question about the phone light. What is that?
Oh, call light is this.
Always there, right?
Call light, yeah. Call lights are always there. Some of them look more like bricks with a speaker. This is like an old-fashioned one. You always have to make sure that it's either near their hand or in their hand. They have to have access to it. It's not enough to leave it up here and say, well, the call light's there if you need it. It's got to be in or near their hand. Okay. So good. So we actually give them the call light. And usually I'll tell them how to use it. If you need me, press the red button. Because remember, they're preoccupied. They're thinking about a million different things. They may not remember how to call, how to call me. So I'll remind them. If you need me, if you need anything, press that red button and somebody will come. Okay. So comfort, curtain, call light, clean environment. Then we clean our hands and chart if necessary. Good. And then the very last thing, you're going to want to write this in. You're going to clean your hands again. This is a new step. So after charting, you have to clean your hands again. So basically when you walk out of that patient environment, you should be walking out with clean hands, having touched nothing else. So the pen is falling into that category now. Okay, which doesn't make sense to me because you wash your hands before you touch the pen. Your pen should always be clean. Yep. Yep. So that's why I'm making a point of it. It's a new step that's required. You must wash your hands again after charting. You have to wash it before, but you have to wash it again after. So what trips up a lot of students is they'll do the closing, right? Thank you very much, Ms. Jones. Is there anything else you need? Are you comfortable? Here's a magazine. Open the curtain, go wash my hands. And I remembered I didn't give the patient the call light. So I wash my hands. I come back over, give them the call light. Now I've got patient cooties on me again. So what do I need to do? Wash your hands again. Remember, patient cooties live all in here. If you've washed those cooties off and you've come back over to the patient, you've re-cootied up. You need to get rid of those cooties so you don't take them to somebody else.
So what if I just use the hand sanitizer?
For the test, hand sanitizer is not used. You physically wash. Okay. So for the test, they are going to grade 2 hand washings. Both of those are for the first skill. So they're going to grade the first hand washing and during the opening, and they're going to grade the second hand washing during the closing.
And the third.
And well, if your first skill is a documentation skill, they won't grade it, but they still need to see it. Okay, so they're not actually grading the mechanics of the hand washing. Okay, and I think there's only one care plan that applies to, and that's feeding. I think there's only one care plan where documentation is your very first skill. But they won't like physically watch you wash your hands the third time. They're still going to grade it that you did it, but it's not, the hand washing itself isn't graded. Now, the reason that that's important, if you remember this, right? We have all of our skills here. Remember, there's 5 skills that you're being graded on. 3 that are on the care plan and 2 that are hidden. One of those hidden is hand washing. So you're being graded on hand washing at the beginning and end of the first skill. After that, they're going to tell you you can simulate hand washing. Simulate means say. Where do those evaluators want to be? Home, in their pool, drinking their Mai Tais. They do not want to be watching you wash your hands. So they will tell you you can simulate hand washing from this point forward. Simulate means say. So I would wash my hands here. Okay. You don't have to physically pantomime. You don't have to just, I would wash my hands here. Okay. Good.
Yep.
It's a way of cutting down that time so you guys don't have to spend so much time at Chili's with 2-for-1 margaritas. Okay. Good. Questions? So let's go back to the test for a second. Now that we kind of understand how this works, you have both gone in, you've been shown around where everything is, you got your care plan set, you did your skills on him. They marked you off every step you did right. You got your care plan set, you did your skills on her, they marked you off, everything you did right. Everything that you missed goes into the computer as a deficiency. You guys go out to the waiting room. You guys are brought in, same thing. You'll do your skills on him, he'll do his on you. You will get marked off. You go back out to the waiting room. Same thing. You guys get brought in. You do your skills on her. She'll do her skills on you. You go back out to the waiting room. You guys stumble in from Chili's. You'll do your skills on her. She'll do her skills on you. Back out to the waiting room. So you can tell each set is going to have about an hour. So now we're 4 hours into this. After that, you will get the evaluator will come out to the waiting room. It takes a little bit of time, but the evaluator comes out to the waiting room, grabs all 8 of you, brings you into the computer room, and you'll take the written test on the computer. Once you do the written test, then at the end of the written test, once you submit it, you will get your printouts for both written and skills as you exit the building. So that's how testing day works. Any questions on testing day?
What about the place that has 16 people coming in?
Well, they still do it in groups of 8. So basically they have 2 sets of evaluators at that place. Yep. It's a busy place. But you'll probably never see group 2 because it's in different places. Okay, good. Questions? Did you learn anything today? I'm not done. All right. So let me explain to you indirect care. So this is the last thing that you're being graded on. Remember, I said 3 skills on the care plan, 2 hidden skills. One is hand washing. The other hidden skill is called indirect care, and indirect care is easier to show than tell. Okay. So I'm going to demonstrate on you. I don't want you to take anything I do personally over the next couple minutes. Okay. But I want you to be agreeable. All right. So I'm going to show you 2 CNAs, CNA 1 and CNA 2. Pay attention. They're going to do the same thing. Okay. So I'm going to simulate a skill. I'm not actually going to do a skill. I'm going to simulate one, but they're going to do the same thing. But I want you to pay attention to how differently they do it. And then I'm going to explain to you the differences in detail, because this is what you're being graded on. Okay. So here we go. Hey, Ms. Jones, my name is Patty. I'm your CNA today. I need to get your vital signs. Is that all right?
Okay.
Now clean hands. Put your hand up here. Start. Stop. Is there anything else you need while I'm here? Call it over there. Wash my hands. Document. Wash my hands again. My skill is done. How many of you guys have seen CNA number 1 out there? Yeah, do we need any more of those? Okay, let's see if we can improve on that just a little bit. Okay, so let's see if we can improve on that. Here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you?
I'm good.
Great. I need to get your vital signs. Is that okay?
Fine.
I'm just going to go close your curtain and wash my hands. I'll be right back. I have clean hands. Okay, Miss Jones, can I get you to rest your arm on the table for me, please? Thank you. This is going to take me about a minute, but I'll let you know when I'm done, okay? Start. Stop. Thank you. Is there anything else I can get for you while I'm here?
No, I'm all good.
Are you comfortable?
Yes, thank you.
Okay, would you like a magazine before I go?
Thanks.
Okay, let me see what I can find. Colleagues over there, we will pretend you can reach it. Environment is clean. Close the curtain. Wash my hands. Document. Wash my hands again. And my skill is done. Which one would you want? Yeah, that's universal. Nobody wants and trust me, nobody out there wants CNA number 1 either. Yeah, it's just the way it is. So what made it different? What made, they did the same thing.
Yeah, but the first one didn't.
Okay. So how did that come through?
She dragged her feet. She just pushed the curtain. She didn't really. She yelled at the patient. Was like, "Give me your arm!" Like, you know.
Okay.
No, so it's gonna make me uncomfortable. It's gonna make me rude if I'm the patient.
Right. Absolutely. Absolutely. So let's look at some specifics like you were going over. So was my walking different? Okay. What about my overall posture? Was that different? Okay. But something that you probably didn't pay attention to, CNA number 1, when approached the patient, talked over there. Yeah, so eye contact. What is half of our job? Okay, observation and reporting. Do you guys remember that? Observation and reporting. How important do you think eye contact is if half of our job is observation and reporting? So during the test, if you're facing this way, you're not observing the patient. Do you see that? Do you see how important that is? So CNA number 2, approach the patient direct from the front. This is also less threatening. It just is. Eye contact is important, but what about facial expression? Was that different?
Sure.
Yeah. Okay. Tone of voice was way different. But here's something, rate of speech. Did you notice that CNA number 1 talked way too fast and didn't give the patient a chance to respond? Did you notice that? They're looking at that on the state exam. All of these things have a totally different grading place. It is a separate test item in direct care. So what you say to the patient, the way you say it to the patient, the way you explain yourself to the patient, the way you carry yourself, eye contact, tone of voice, all of that falls under indirect care. And it's graded because we don't need any more CNA number 1s. We just don't. So we need to do this with a little bit more care and concern. Now, I know you're going to be nervous on the test. I get it. And that's okay. Nervous is okay. Rude and uncaring is not. Good. Questions? So a couple of years ago, there was this one CNA school in Tampa. This just cracks me up. So somebody along the line had told them that the test was stressing getting permission, right? So getting permission from the patient. So this CNA school, for whatever reason, I don't know why they did this, but we all cracked up, trained their CNA students to do this. Permission to enter the room. My name is Patty. I'm your CNA today. Permission to do hand and nail care, permission to close your curtain, permission to go wash my hands. I mean, like it was robotic. You would never talk that way in a real, if you really did that in a real setting, can you imagine how freaked out those patients would be?
They'd be like, get out.
Oh my gosh. I mean, remember, they all think they're dying anyway. So you start doing that and that's just going to really freak them out. Yeah, exactly. I don't know why they did that. I mean, they stopped doing it pretty quick when all of their students failed in direct care, but yeah, this is kind of understand that CNA teachers don't have to take a class to be a CNA teacher. How many of you guys have a garage at home? Yeah. Any of you can operate a CNA test prep tomorrow? You can. Go put a couple tables and chairs in your garage and advertise. There's no regulation here. None. All of you can be CNA teachers tomorrow. Yep. So that doesn't mean that, you know, the people that you're testing with took a class from somebody who actually knows what they're doing. That also means that some of the people that you work with didn't necessarily take a CNA class with people that know what they're doing. So as long as you got lucky, pass the test. Yeah. And there's a lot of people who do nothing more than watch my videos online. I mean, I know it because they come and tell me all the time. Hey, I challenged the CNA exam. All I did was watch your videos and I passed. You know, they parroted what I did, but that doesn't really mean that they understand why they're doing it, which is why I created the online program, because there's a lot more to this than just copying my motions and my words. Okay. Good. Questions? Okay. So do you know how we know what to do? So how do we as CNAs know what to do with each patient? Care plan. If we can't follow the care plan, we tell the nurse. We follow the care plan, the whole care plan, and nothing but the care plan. What is the one action you have to do before you enter a patient's room? Knock on the door. You have to identify yourself by name and title, position. Yeah. Once you describe the skill, what do you have to get from the patient? Permission. Sure. When do you want to wash your hands? Before you go into the room or after your opening? After your opening. Very good. And you have to have clean hands to get your clean supplies, right? Can't touch supplies without washing your hands first. All right. The closing is going to be at the end of every skill. 4 things we don't care about the order. Can anybody give me any of those? Comfort, call light, curtain, clean environment. Once we do all that, we've all cootied up. What do we want to do with those cooties? Okay. And then document if necessary, chart if necessary. But if you do chart, what do you have to do? Wash your hands again. You have now learned out of 11, 3. Yep. So guys, I still have 3.5 weeks with you. Okay. We're going to get to the rest of them. Don't sweat it. We'll get there. But look how far you've come already. You also understand how the test works. You understand your role, and you understand the patient experience, which we spent a lot of time on today. Okay. Is everybody comfortable with where we're at and where we're going? Did I go too fast for anybody? Is anybody unhappy with the course? This is your class, not mine. I'm just up here to help you, but this is your class. So please let me know if you need any changes made. I know the room is cold. We only have 2 temps. It's either hot or cold. That's it. So bring a jacket if you need one. Please remember you have homework. So let me go over the syllabus with you again real quick. You're going to read chapter 1 in your blue book. You're going to take the test on page 132 in your white book and grade it using the answer key at the very back of the book. Now, something we did not get to today that I do want you to read. In the second column, The second item says delegation differences, pages 8 to 16. I would like you to read those pages in the white book. You don't have to, I won't quiz you on it. You're not going to have to, but this is something that will probably be a good reinforcement for you. Everything else we've covered in class, including the last column. Everybody is coming back, right? All right, so let's talk about Wednesday. This is a review sheet. I just started making these. I made these for my last class. They really liked them. So I'm continuing it on. This is everything we went through in class today. But what makes this interesting is at the very end, because you're going to get one for each class. And it's just kind of a review of what we went over the last 4 hours. But this makes a really good review at the end of the class. Like when you're getting ready to test, if you keep all 8 of them, everything is there. It's like notes, like really condensed, focused notes. Okay, so I'll pass these out. So what do you guys want to do about Wednesday? I'm going to give you 3 choices. I want you to vote for the one that you like. So the first choice you have, I hope I have enough. The first choice that you have, I'm going to have to print one more. I'm sorry. Hold on 1 second. Is just have a short day on Wednesday, just 9 to 10:30, an hour and a half, and we'll make up everything else as we go. You know, I'll just add skills into each day and just kind of keep the times. So your first choice is just meet on Wednesday as regular, just a short day, and we'll have to make up the skills as we go. Second choice is to meet later on Wednesday from 1 to 4. Anybody want to meet later on Wednesday from 1 to 4? Okay, and the third choice is to meet tomorrow instead. So the first one, okay, so just on Wednesday, we're going to meet regular time, 9 to 10:30. I have to leave at 10:30, but I will put the rest of the skills into the classes that follow. Okay, everybody good with that? 9 to 10:30 on Wednesday. Okay. And I've got some time at the last day that we don't have any skills. So I have that kind of as a makeup time as well. So let me print out one more of the review sheet. And you're going to get two, I know I've got like 30 seconds here. You're going to get 2 emails from me. Oops, I don't think I did that right. One of them is going to explain all of the resources that are available to you, where to find the videos, and how the online course works. The second one will be your invitation to the online course. Please remember, when you register for that online course, you use the same email that the invitation was sent to. Okay? All right. Any questions? Thank you. Okay, guys, it was a pleasure meeting all of you. Have a fantastic day.
See you on Wednesday.
See you Wednesday.